you're literally retaining water under the skin, and the face becomes more swollen, becomes more like moon shaped. Let me do this real quick. There we go. I'll turn this. Hi, guys. Hi. Becomes more moon shaped. And you'll also see this myxedema in the neck. You'll see it in the back of the arms. It's this weird thickening of the skin. It's like water retention underneath the surface. Here, let me go. Hi, guys. These are my YouTube people. These are my VIPs. And then we move down. Did you know frozen shoulder? Frozen shoulder can literally be a thyroid issue. Let's see, rapid heart rate, AFib, tachycardia. Many of you are literally getting diagnosed with heart issues. You're being put on beta blockers. Some of you have even had, what is that called? Ablation. Many of you have had a heart ablation and you really didn't need it because it was actually just hypothyroidism. Wonky cholesterol panels, also tied to our heart. Low or high blood pressure, that's classic as well with hypothyroidism and Hashimoto's. Then we move down to the gut. Bloating, slow gastric motility, constipation is classic with hypothyroidism because everything is low and slow. So when we say hypo, think hypo, low, and slow. Hypothyroidism, low and slow body function, hypo, low, and slow. So this is where our entire body slows down. Metabolism, mood, hair growth, energy, even down to your mitochondria. Your mitochondria produce something called ATP. And that really is what gives us energy and fuels our body through the day. ATP production drops. That's where you get that fatigue and exhaustion. Dry, cracked elbows, dry, cracked heels. That is also connected to hypothyroidism. Now, if we get into the wacky and wild symptoms, these are the ones that you don't really hear a lot about, but they absolutely are connected to having a non-optimized thyroid or having hypothyroidism. This is going to be migraines. Migraines are a big one. And I know so many women are dealing with migraines during perimenopause and menopause. So hormonal shifts can absolutely cause migraines, but so can hypothyroidism. I mentioned frozen shoulder, but we're even going to go deeper and we're going to go into muscle and joint pain, those connective tissue disorders where you just have, it's almost like fibromyalgia. And especially if your reverse T3 is high, which we are absolutely going to be talking about today. So make sure you stay tuned and stay on for as long as you possibly can. Just as a reminder, this is not being replayed. This is not being sent out as a replay. This is not being recorded. We're recording it for our team, but we're not recording it for you. So if you have these 5 hours to block out to take time for yourself, make sure you do so because you deserve this. You really do. Yes.
Get him a coffee, come back in 1 minute.
Okay.
Coffee and get back because we'll be able to chat. You just have to get off to come back in. So tell them to get her coffee and come back in.
Oh, okay. Because we want to enable the chat so we can see everybody in the VIP room. All right. So I am going to bounce off. Only me, right?
Oh, they'll get kicked off. Just come straight back onto the Zoom link. So they just got to come straight back onto the Zoom link and the chat will be enabled.
Oh, okay.
Yeah, so just going to come straight back in.
We have 433 people.
And 433 people will come back.
Okay. 433 of you are going to come back in. We want to be able to see our VIPs in the chat. So we're having a weird Zoom snafu. You YouTube people can just hang out. We'll get you in a second. Your YouTube is fine. It's the Zoom. It's the Zoom where the chat is being wonky. So DJ, all of you guys, we are going to click off. I want you to go to your email or wherever you have the Zoom link and give us 20 seconds?
Like legit, yeah.
Legit, 20 seconds. We're going to refresh. We're going to all come back on. Then that way I'm going to be able to see your chat because it's important for me to take your questions. You are my VIPs. You are my VIPs. Okay, here we go. We're going to see you back in 20 seconds, 20 seconds, 20 seconds. People are popping off now. 20 seconds. Ready? End it.
Yep. You end it and Zoom, we're still going.
Bam. Okay. YouTube, we're still going. I love you guys on here. Let's see. Oh my gosh. Well, while I'm waiting, now let me come back on here. Okay. We're going to start this. Oh my gosh. I love you guys on here. Please explain thyroid hand, how to reverse it. You know, Catherine, I think I saw your post in the Just Fix Your Thyroid Facebook group. And I did reply to it. I have not heard of thyroid hands before. So, what I want you to do is in the chat, or if you're over in our VIP Zoom room, Miss Catherine, because you are in the Facebook group as well, I'd like to know more about it. So give me more information on what you mean about thyroid hand. Are you talking about it just being, let me get in here. The spotlight. Okay. We're going to start this. Okay. Here we go.
Recording in progress.
Now, Catherine, are you talking about just being dry or your hands crampy? Because fibromyalgia-like symptoms are a very real thing when we're talking about a non-optimized thyroid, and especially if your reverse T3 is high. All right, so people are popping back in. They're climbing. And now
We're good.
What's that? Now we're able to see the chat. Woohoo! Okay. We are able to see the chat. So now should they put it to hosts and panelists or to everyone?
They could do both. If they want to just be private, they can, but everyone.
Okay.
I like everyone.
All right. Now we can see the chat. Oh, this is beautiful, beautiful, beautiful. So hopefully everybody will pop back on. And we're waiting for about 100 more people to pop back on here. They'll figure it out. Okay. Hopefully they were listening. There we go. All right. So Dawn, I see you with your hand raised. Go ahead and pop any of your questions into the chat, because since this is a webinar format, I can't unmute you, but I can absolutely see any question that you pop into the chat. So do that for me. Anyone on YouTube. Okay. If you want to be part of the VIP room, then make sure you purchase a copy of the Thyroid Fix. It's on Amazon. We'll pop the link into the chat section here. It is on Amazon. You can get it on Audible. You can get it on hardcover, on Kindle. By the way, on Audible, for anybody that did purchase a hard copy and you're into listening like I am, on Audible, I actually added bonus sections at the end of every single chapter, because those of you who know me, I know my VIPs, they know me. You guys kind of get me. If you've been listening to me for a while, I like to riff. I love to teach. I love to talk. I love to educate you. So I wanted to add more than what actually made it into the book. So I did that in the Audible version. You have a little bonus section at the end of every single chapter of the Thyroid Fix. Crystal, I know, right? I like to listen too. I love to listen to my books. I'm not really a reader. I'm just not a reader. Okay. Let's keep going. So those are the wacky and wild symptoms. So as you were jotting those down, I would love to see, like, even if you just pop it in the chat, just give me a number. How many of those? I mean, you guys can pop it in on YouTube as well. How many of those symptoms do you have? The top three: the weight loss, the inability to lose weight loss resistance rather, exhaustion, hair loss, hair thinning, dry hair breaking, anything. How many of those symptoms do you have? I want to see a number in the chat. Yeah, okay. And Miss Catherine, okay, thanks for clarifying. This is when your hands and fingers get numb and tingling. Okay, so I'm not really quite sure, Catherine, that that's a thyroid thing, because that could easily be like a pinched nerve, your brachial plexus nerve. What is that? Carpal tunnel, which sometimes is carpal tunnel, sometimes it's not. Catherine, I'm sure you've done all the things, the massage, the chiropractic, all of that. That's just not, that thyroid hand didn't even make it into the book, because I haven't heard it from anyone else. So I'm not dismissing it, girl, but I'd like to know what your other symptoms are as well. What are your other symptoms? Okay, so we still can't see people's. Okay, we're figuring it out. God, I love technology. I absolutely love technology. All right, so we got the symptoms down. Now, so many of you have a lot of these symptoms, and you're on the struggle bus because you're like, wait a minute, I'm already diagnosed. I'm already on some type of thyroid therapy. We're going to get into what you're probably on, i.e. Synthroid, levothyroxine, right? Tirosint, T4 only, and that's not working. Or maybe you're even on natural desiccated thyroid medication, and that is not working, and you are still dealing with these symptoms. Well, I'm here to tell you that there is a way out. You should not be dealing with those symptoms. When you are truly optimized, truly optimized, you do not experience symptoms. You don't. You have none. You are living your best life. I'm always talking about optimization land, where it's a place where you're not gaining weight, looking sideways at a brownie, and you are absolutely living your best life. Energy through the day, not counting the hairs that are coming out of your head. It's a beautiful place to be, and you can get there. I promise you, you can get there. So if you have any, oh gosh, I'm seeing 8, I'm seeing 10, 5, 7, my gosh, the amount of symptoms that you guys are dealing with. I'm telling you, 3 or more of those symptoms, and you have hypothyroidism, Hashimoto's, and we need to do something about it. Okay, I see a lot of questions coming up about the labs. Which lab should we get? Now, in about maybe 20, 30 minutes, we are going to be going into lab read, right? Because that's what's next. So we're going to be going into live lab read. So many of you bought 5 copies of the Thyroid Fix. So thank you. And that qualified you for lab read, provided that you actually submitted your labs. So we have those fired up and ready. So anyone listening, you are going to learn so much from these live lab reads. But before we dive into that, let's actually, Caroline, I know we're working on that. We're totally working on that. And Dina, I know we're working on that too. Okay. You're just on Zoom. It says Zoom disabled. Yep. Devin, I know. And you're one of the lab reads too, girlfriend. So try to hang in there and we will get this up and running in Zoom. Technology. Mm-hmm. Okay. So when we're talking about labs, I see many of you in here saying, my doctor won't test T3, my doctor won't test reverse T3. And that's a huge problem. So even some of the labs that were submitted for the live lab read, what you're going to find is very, very interesting. We had a lot of those submitted without a reverse T3. And that's where I just go, oh my gosh, you've got to be kidding me, right? Because we can't tell anything without a reverse T3. For those of you listening on YouTube, and my VIPs, I think all of my VIPs are in the Just Fix Your Thyroid Facebook group. For all of you listening on YouTube, you want to join the Just Fix Your Thyroid Facebook group. It's Just Fix Your Thyroid, Hormones and Metabolism, but look for Just Fix Your Thyroid. And in that group, you can post your labs. I'm in there. My nurse practitioners are in there. My team's in there. We're in there all day, every day, just loving on you, helping you, supporting you, telling you what your labs actually mean. It is the most beautiful Facebook group out there. I'll tell you, I've been in a lot of thyroid Facebook groups, and so many of them are just complaint sessions, or they're trying to sell some kind of multi-level marketing product. We are there to help, empower, educate, lift you up, love on you as a community, because that is my passion. That is my absolute passion. That is another reason why I wrote the Thyroid Fix, because I love you all. And I've been there and I've done that, and I've been in your shoes, and I've struggled, and I was misdiagnosed 6 freaking different times. So I get it. And you're going to hear more in depth of my story later. I mean, the scale went up. I always say it went up 25 pounds, but that's when I stopped getting on the scale. The scale really went up 35, 40 pounds before I was actually diagnosed. So I completely and totally understand where you're at and where your frustration is. And that's why we're doing this. And that's why I love on you. And that's why I created the Just Fix Your Thyroid Facebook group, because I've been in your shoes. So if you're in there, awesome. If you're not in there yet, make sure that you jump over to the Just Fix Your Thyroid Facebook group. And everybody on YouTube, hello. I know that we still can't use the chat. We're working on it. I got my team. They're all like running around back there, the tech team, trying to figure out what's going on with Zoom. But we'll get it. We will totally get it. Okay. So what was I saying? Oh, labs. Wait, do we have an answer? Oh, no. Okay. Labs. So with labs, you absolutely need I got my tech crew coming in helping. You absolutely need a reverse T3. Because without it, we can't tell a thing. And when I pull up the labs, when we do our live lab reads here in the next, 15, 20 minutes, you're going to see that a lot of people did not have, let me move over for you. Thank you. My tech person's coming in. A lot of people did not have a reverse T3, and that really blows my mind, quite honestly. because reverse T3 is one of the most important lab markers you can get. I always say if you don't have a free T3 or a reverse T3, you really have nothing. Like we can tell absolutely nothing. And if your free T3 is low and or reverse T3 is high, then you are deeply, deeply hypothyroid. So let's go through. I'm seeing here, okay, CASM, 8 symptoms, low free T3 of a 1.4. Oh my goodness. Okay. All right. Hold tight. I want to break that down. So when we're looking at the labs, here are the labs that you absolutely have to get. Number one, obviously TSH. They're always going to test your TSH. That's just standard. When you go into your doctor and you say, I want to get my thyroid checked, we know they're going to test your TSH, but that is a brain hormone, not a thyroid hormone. So we have to keep going from there. Now, free T3 is another marker that your doctor will very easily jump in and test. That's almost a no-brainer as well, except that the free T4 or T4 in general, total T4 and free T4, inactive thyroid hormone. T4 is completely and totally inactive. It literally does nothing in your body. It does nothing. So when we test T4, what we're doing is we're actually looking at the inactive thyroid hormone, which that kind of makes no sense. Now, I want to know how much is there, because here's the kicker with the free T4. And we talk about the optimal lab value ranges in the Thyroid Fix. They're all laid out for you, all of the labs to get and where you want to fall. But free T4, I actually want to see lower. I actually want to see free T4 lower. And here's why. If that free T4, and there's a lot of Instagram influencers out there that they want to pretend like they know what they're doing with the thyroid, and they'll post up some optimal lab value range. And that free T4, you know what it'll be marked as optimal? It'll be marked at 1.5. I call timeout. Stop. Absolutely not. Free T4 needs to be under a 1.2. If free T4 is above a 1.5, you are going to be having reverse T3 issues. You're going to be having conversion issues. If it's above a 1.5, that tells me that either you producing your own thyroid hormone, your body isn't even converting it right, or you are on way too much T4 thyroid hormone replacement, either in the form of natural desiccated thyroid or in the form of levothyroxine or Synthroid. You are on way too much T4 thyroid hormone. And I don't care whether you're seeing a functional doctor, an integrative doctor, or a clinic. I don't care. If your free T4 is too high, you are most likely on too much T4 medication and you're going to be having issues converting. I see this all the time. That's why I wrote about it in the book. I see it day after day after day of people coming into the Advanced Thyroid and Hormone Clinic, and they are stuck. They are stuck. Nothing is moving. They're not losing weight. Their hair's falling out. They're anxious. They're depressed. They're exhausted. And it's all because they're on too much T4, even in the form of NDT. Okay, next up in the labs, you must get free T3. T3 is your active thyroid hormone. I love me some T3. Love it, love it, love it. Full chapters in the Thyroid Fix on the importance of T3. And we also break down the myths that you've probably heard from your doctor. Like, we can't give you T3 or you're going to have a heart attack, or we can't give you T3 or you're going to have bone loss. Well, that is simply not the case. That is simply not true. And T3 thyroid hormone will literally save your life. But we need to know how much free T3, the active, ready to give you that metabolism and light your brain up and give you energy and let you poop every day. We want to know how much active thyroid hormone you have in your body. And the only way to know that is by testing your free T3. Finally, we have to check your reverse T3. And this is what you're going to see coming up. So many people did not have the reverse T3 tested. This must be done every single time. Not every other time, not once every 6 months, not once a year. Every time you have your thyroid panel drawn, you must have a reverse T3 on there. Do you hear me? So if you do not have reverse T3, we literally know nothing. We literally know nothing. Reverse T3, and we're going to go so much deeper today, so much deeper. I hope you've blocked out 5 hours. If anything, if you have to go, I want you to make sure you come back at 2 p.m. Eastern, 1 p.m. Central. What would that be? Noon Mountain, 11 a.m. Pacific, because that is where we're going deep into these labs, even into the lab values, reference ranges, optimal values, all that fun stuff. And we're going to talk about what's keeping you stuck. And we're going to talk about thyroid medication. Right now, it's important for you to know that reverse T3 is vital. It tells us how well you are converting the inactive thyroid hormone, T4. Remember, I said I don't want you to have an elevated free T4. It's telling us how well you're converting that T4 thyroid hormone into the active form T3. So we can look at your free T3. We can look at your free T3 and say, is this in the optimal range? But even if it's optimal, we still have to know your reverse T3. And I posted this in the Just Fix Your Thyroid Facebook group the other day. The number one way to tell if you are with a doctor, a practitioner, an NP, a DO, a DCN, a CFMP, whatever letters are after a person's name that are helping you out with your thyroid, the number one way to tell if they know what they're doing with the thyroid is if they test your reverse T3. If they test your reverse T3. If they do not test your reverse T3, then the translation of that, the translation is, I'm sorry, I don't actually know what I'm doing with the thyroid, but I'm going to take your money anyways, or I'm going to charge you your copay. And I'm just going to tell you, I can fix your mold and your adrenals and your gut. Oh yeah, Susie, we can fix your thyroid. And then they scream it at you on paper by not testing your reverse T3. And what are they screaming? I lied to you. I don't actually know how to fix your thyroid. I don't know how to do anything except maybe this gut healing protocol that I sold you for $4.99. But I can't fix your thyroid. But I'm going to fake it till I make it. Always, 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 always get a reverse T3 every single time. Every single time. Now, what will you hear from your doctor when you ask for this reverse T3? If you're not working with someone who knows what they're doing with the thyroid, here's what you're going to hear. We only test that in clinical settings, to which point you can say, excuse me, doctor, yes, I understand that, because, our bodies are so smart. Our bodies are so beautifully built that my body knows that if I am in that clinical setting and I am dying in the ICU or the ER, my body knows at that point of time that I don't have to burn fat. I don't have to make major decisions. I don't have to poop every day. I have to lie here and survive. I have to lie here and survive. But what if my reverse T3 doc is elevated, when I'm trying to walk around and live life, when I want to live my best life, when I have things to do? What if it's elevated then? And see what he or she says. Because they need to be able to explain to you why they're not ordering that test. And I'm going to tell you right now, there is no acceptable explanation. They should be testing this every single time. And finally, we move on to the TPO and TGA antibodies, thyroid peroxidase and thyroglobulin antibodies. These antibodies are markers for Hashimoto's. They have to be at 0, by the way. I will give you that optimal range right now. Your antibodies have to be at 0. 0, 0, 0. If they are above a 0, then you have Hashimoto's. If you have any antibodies whatsoever, then that is telling you that you have Hashimoto's. Now, we're going to get into the combination of labs and what we're looking for in about 10 more minutes. So hang tight. This is going to be super fun when we actually go through lab values. But okay, I'm going to give you the optimal ranges though, because I know you're sitting there with your pen and paper. I know you're taking notes. You're hanging on here with me. I love you all. I love seeing this. I love seeing you in here. I know my VIPs were still working on the damn chat, and my YouTube people. I love what you're putting in here. Woo!
No, it works.
Oh, we got the chat working. Bam! Now we're rocking. You're amazing. My tech crew's amazing. This is Jill.
I almost got fired there, guys, but we're good.
No, she'll never get fired. Okay, so thank
Look
you
at
for your
that.
patience. Woo! Yeah. I love you, my VIPs. Here we go. Finally. Woohoo. Yeah. Now we're partying. You're getting some good job, Jill. Don't fire Jill.
Don't fire Jill.
Thank you, Jill.
Oh, I love you all. Thank you.
Oh my God.
I'm going to screenshot that.
Cooking with gas. Oh my God, I love these people so much. They're cracking me up. Patty Hall. She's book Patty. She says, hi, Jill.
Oh,
Hi, Patty.
oh.
Hi, Ingrid. I see you guys in here. Miss Carolyn. Oh, I get to see everybody now too. Ah, this is so much fun. So much fun. Okay, I'm running both chats here. All right, this is amazing. All right, you YouTube peeps, I see you posting your labs over there. You make sure that you join the Just Fix Your Thyroid Facebook group. I will get to some of these but we got like 500 people over here in VIP. So you better bounce over to the Facebook group, buy a copy of the book, and then jump into our VIP section over here so you can post your labs and I'll go through them over there. Miss Haida, I see you in here with your labs. Let's see. We got T1234 with low progesterone. Yeah, okay. And a reverse T3 of a 17. So you guys got to pop over here. All right, my VIPs. This is amazing. This is so much fun. I'm going to pull up the chat here. Okay, I'm going to move you guys over here so I can see everybody. Okay, holy cow, that was crazy. Yes, thank you, Jamie. Love you too. Yay. Okay.
We're giving them an extra bonus at the end of the day. They're all bonus.
Nice. Okay. Everybody on my VIPs over here, that Dr. Amie is like a thyroid party DJ. Okay, everybody in my VIPs, at the end of the day, you guys are getting an extra bonus.
You don't even know what it is, but they're all getting a bonus.
Yeah, you're all getting a bonus. So make sure you are on here between, let's see, the most important time. If you have to bounce off and get lunch, just pop me in your ear. Keep this rolling because you're not going to want to miss any of it, but you got to be back here by 2 p.m. Eastern, 2 p.m. Eastern, 2 p.m. Eastern, because between 2 and 4 Eastern, that is where we are getting down and dirty. We're announcing prizes. All you VIPs are getting extra stuff. This is going to be fun. Okay. Over $10,000 in prizes, $10,000 in prizes. You're not going to want to miss it. You're not going to want to miss it. All right. So before we go to the labs, I want to take a couple moments with my VIPs here because we got some questions coming in. So here we go. I'm just going to, Hugo, are you on here? Oh my God, Dr. Hugo. I love seeing you. This is amazing. All right. Just for you, my dear, just for you. What level of reverse T3 will you allow in the normal range? You guys over there in the UK, Dr. Hugo is freaking amazing. Anybody in the UK, by the way? Dr. Hugo Kitchen. Is okay. Normal range is 12 to 35. Patient said mine is 17, so I'm okay. Well, Dr. Kitchen, you and I have had many chats about this, and we basically share a brain. So we know that we're not loving the 17. Now your range is a little bit different, but it's only really bumped by about 10 points. So again, when someone's reverse T3, I would say a 17 is like, she's pretty borderline right there at a 17. So what do we have to do? We have to ask the 4 most important words that any doctor can ever ask you. How do you feel? Right? So if that patient feels like garbage and they're still experiencing any and all of the symptoms, then that reverse T3 is too high, and we got to check the free T3 and see what those markers are. This is where reverse T3 is so important. Okay, Haida, thank you for learning about me, from Dr. Tina. We love Dr. Tina as well. Oh, thank you so much. All right, let's see here. Let's take, before we jump into the labs, we got a couple more minutes before we jump into the labs. Deb Doctor, your reverse T3 is a 27.3. Well, okay, Deb Doctor, then we need to do something about that because that is way, way, way too high. So if you're walking around with a reverse T3 of a 27, reverse T3 optimal, we want less than 12 in the US system. Now, like we talked about with Dr. Kitchen, it's a little bit different over in the UK. It just shifts a little bit. But in the US system, we want it less than 12. I would say in the UK system, let's see, since you guys are starting at a 12, we're starting at a 9. I mean, it's not that much different. So you're talking about 12, 13, 14, 15. You would want it less than a 15. So the 17 is a little bit high, doc. And then reverse T3 in the US less than 12. So Deb Doctor, if you're walking around with a 27.3, your poor body is literally in lockdown survival mode. Like it thinks that you're lying in the ICU or the ER fighting for your life. So for you, and I go into this in the book, so in the thyroid fix, I literally have it broken down. If your reverse T3 is between this and this, if your reverse T3 is between this and this. So Deb Doctor, your reverse T3 would be in the category where I would honestly say you need to go T3 only. You need to pull out your T4, pull it out completely. So Deb Doctor, I would love to see if you can pop this in the chat, just what thyroid medication you're on. What thyroid medication are you on and in what dose? I'm just curious. Okay. And Deb Doctor says, my doctor won't do further testing. Time for a new doctor. Yeah. Oh, yeah. You know that, Deb. You know it. Okay. Oh, yeah. You're not on any medication right now. Okay. Yeah. Dr. Hugo, make sure you're posting that to everyone. You're just popping it to hosts and panelists. So put your information in the chat for everyone because my peeps in the UK need your help. They really do. My peeps in the UK need your help. Monica, your free T3. Oh, wait, the chat's moving. Your free T3 is above a 20. That doesn't sound quite right. Did you mean to say you meant your reverse T3 is above a 20, but your free T3 is below minimum and your doctor says you're fine. It's normal. Okay, what do we say? Everyone that got the book, we have this in the book. It's my famous line. You can all use it. You can all use it with your doctor. Normal is a setting on the dryer. Normal is a setting on the dryer. We do not use the term normal to describe our health, to describe our labs, to describe how we feel. It should be optimal, amazing, I'm a badass. Unless you can answer it that way, then you are not optimal. You're not normal, right? We're not going to use that. We're not going to allow our doctors to use that. But Miss Monica, obviously, if your reverse T3 is above a 20 and your free T3 is low, I tell you exactly in the thyroid fix what to do. Okay, so now it is time for our live lab reads. Here we go. Now, if you guys are on, if my VIPs are on, I want you to not unmute, but I want you to be active in the chat because I'm going to be asking you some things here. All right, wait, let's see here. Okay, I can't pull Zoom with this. So let me come back over here. And give me 1 second. I'm just pulling up the labs. Start. I can't get to Zoom. So I'm going to have to share my screen here first and then come back over. Okay. All right, my beautiful Zoom people. Here we go. Share. Right. Okay, here we go. And PowerPoint. Share. Now we're going to play. Here we go. Okay. Now what are you seeing? I need to see what you see.
No, you're good. You're good. Yep, the chat box looks beautiful.
Right, but what do you see?
I see both.
We need, right, no, it shouldn't do that.
Can I hit presenter view?
Presenter view. This one.
Yep.
Well, they might see both. No, you're seeing this. They're seeing this.
Mm-hmm.
All right, we're good. We're good.
Yep.
Okay, so who is this now? This is Leslie. Whoops. All right, we want to go back. Leslie, Boersma. I'm not quite sure how to say that, but Miss Leslie, let me get the chat up too here. Because I might be asking you some questions in the chat, Leslie. Okay, here we are. Hi, Leslie. I see you here. All right, my dear. Tina says she can't read the screen, but you guys can all. Leslie, can you see the screen? You're seeing the black notes screen on your PowerPoint. Yeah, see, that's what I'm. Yeah, this is why I'm not quite sure why that's doing that. I just want to do the slide. What if I just blow it up?
You could blow it up, sure.
Go. What if we go big? Go big or go home. All right. We're just going to do this.
I like it.
That's good. Okay.
Well, play from start.
No, play from start doesn't do it either. It just,
that looks great.
It does the black stuff. Okay. You guys can see that. All right. So now, all right, let me bring the chat back up here. Got the chat back up. Okay. Here we go. Notes went away. And that's all right. I don't need the notes. I just want to see these. If you blow it up, Jill will fix it. Yeah. Cutting off the screen. Can you go to slideshow? I love these people. Go to presenter screen.
That's what we did, guys.
Yeah. But then you see the notes. It doesn't, I hate PowerPoint. This is weird.
You just keep talking to them.
Well, okay. Anyways, for Leslie, here, wait, let me move, let me move this black thing here from, wait. Let me get this out of the way. Now we move the Deb. Wait, no, we got to get back to Leslie. All right. We're just doing this here. Can you see Leslie's? Can everybody see Leslie's on here? You got to be able to see this. Okay. We're just going big. All right, Miss Leslie. So is this true that your free T3 is literally non-existent? Close the side panel. I don't know how to close the side panel. I don't know. Cut off at the right margin. You should hire me. Yazine. Yeah, the results are cut off. Okay, people can't see it.
Okay. You know what? Keep going.
Try play from the start. It's off the side, so can't see the whole thing. Okay, they can't see this. That's the problem. All right. Play from the start. Yeah, I think you're just going to be able to see the note, but I don't have notes. So,
No, we don't. So pull that. No worries.
So we're just going to go here and like, what about like making it big? No. Oh my God. Oh my gosh.
No, you're good.
Oh, okay. All right. That's good. All right. The other screen was better. I don't know. I don't know.
Yeah, that screen's better. Go with that.
Click on slideshow. I'm telling you, like, oh, wait, did that do it? Can you use the slideshow? I know. Okay. All right. Yay.
You did it.
I love you guys. This is so much fun hanging out with all y'all in here because you're all like you're helping me out, and I just adore it. It's so much fun. All right, Leslie, back to you. I saw your answer in here. So your poor free T3 is non-existent. So free T3 should be in the upper quadrant of the range. So if we're looking at her now, can you see it on YouTube? I'm back to your, okay, here we go. Okay. So your free T3, if we chop this range into 4, you really should be, my goodness, like a 3.5 to a 4 or over. Cause I always say upper quadrant of the range or over. So, oh my gosh, that's insanely low. That is insanely low. So if you look down below, Leslie says she started on levothyroxine at 100 micrograms daily, liothyronine. She's on a baby dose. She's on 5, this should be micrograms, 5 micrograms twice a day. That is a very, very, very low dose still. So Miss Leslie, can you pop into the chat what your symptoms are? Because you probably have yeah, that's what I'm thinking, Hugo. Are you even able to stand? Like, how are you even functioning right now, Miss Leslie? The other thing that is missing, and this is the point I was making from the beginning, Miss Leslie is obviously with someone who doesn't know what they're doing with the thyroid because they didn't even test her reverse T3. So we see and she's on 100 micrograms of T4. So that concerns me with how low her free T3 is. If she was truly converting properly, then her body would be taking that 100 micrograms of T4 in the form of levothyroxine and converting it over. Not doing anything. Even her free T4 is low. She has Hashimoto's with the positive TPO antibodies at a 410. So we know that her thyroid is being destroyed ongoing. The other thing we can see with Miss Leslie is that her estrogen and testosterone, it's too low of a dose. 10 micrograms is not enough T3 to pull you out of this poor hole that you're in with your free T3 being so low. It's just not enough. It's not enough. All right, Miss Deb Brida, are you on? Oh, Leslie, I can't tell you how much to ask for. I'm just going to say you might need to get a new doctor because your doctor isn't even testing reverse T3. Not even time, but I can't give you medication advice per se. I do kind of go into it in the Thyroid Fix. So you can read that and kind of get an idea that you're going to have to increase your T3 and drop your T4. But I'm going to urge you just based on what we're seeing here. And I think everyone is like, oh, these labs. Oh my gosh, Leslie. Really, I would just love to see you. I mean, book a call with the Advanced Thyroid Hormone Clinic. You can go to dramie.com. We can pop that link into the chat. Jamie, if you happen to have the book a call link, we can pop that in the chat. But yeah, you got to get away from this doctor, Leslie. All right, Deb, you're here. Yay, Deb. Okay, let's do this. 88 micrograms of Levo. So Miss Deb is on T4 only for 10 years. Now, here's a real quick stat for anyone out there, anyone on levothyroxine, Tirosint, Synthroid. T4 only will only work in about 2% of you. 2% of all of those listening to me right now who are on T4 only will do well on. Now, when we even break down do well on, what the hell does that mean, right? Does that mean that we get to lose, 2 pounds instead of the 20 that we need to lose, that we get a little bit of energy, but not a full amount of energy? I can tell you clearly at the Advanced Thyroid Hormone Clinic, we do not ever leave someone on T4 only. It doesn't work. It just doesn't work. I mean, even if you're sensitive, we're going to try to pull in some slow release T3 for you for sure. I mean, T4 only does not work. So Deb, you're on T4 only for 10 years. I'm so sorry. I know that's horrible. Okay. And your TSH is fine. It's within range. It's actually optimal. So TSH, we want below a 2. TSH is optimal here, but that doesn't mean the Deb's optimal. No, it doesn't mean Deb's optimal at all. Free T4 is a 2.7. I don't like it that high. Now your range is a little bit different, Deb, but I still don't like it that high. Let's see. Okay, you have a free T4 index and then a free T3 of a 1.3. That's a little bit over where I like it. Your free T3 is low at a 2.9, and we can see because your doctor actually tested it, thank goodness, we can see that your reverse T3 is a 19. So that is way, 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 way too high. So you, Deb, right now, 88 micrograms of Levo, you desperately, desperately, desperately need, you had to get your own labs done. Okay. All right, Miss Deb. You need lower T4. So we would really drop that down. And again, that I have for if you fall between, if you have a reverse T3 of a 19, here's where you're going to fall and here's what you need to do. And this is where I'm telling everybody on YouTube listening to me now that you're going to want to get a copy of the Thyroid Fix, because that is exactly what I do is I break down literally where you are falling in these labs and what you need to do with your medication, especially if you are being treated already. Okay. So the labs that we're reading right now are people who bought 5 or more books. And then obviously if we have time or when we're diving into Q&A, we can get more into the labs that are being popped into the chat for my VIPs. So where should reverse T3 be? Less than 12, less than 12, less than 12, always less than 12. So Miss Deb, yeah, you need a medication change for sure. Now with your TPO and TGA antibodies being present and being there, like we know you have Hashimoto's, I would absolutely go on Hashimoto's Fixer, or Hashimoto Support by the Fixer is what we changed the name to. So that we have seen easily push those TPO and TGA antibodies to zero. I mean, Hashimoto's Fixer, we have had numerous emails. We've had reviews from people saying, oh my gosh, my Hashimoto's went into remission. My number is zero. It dropped my antibodies by 200 points or more. So Deb, I would absolutely get on Hashimoto's Fixer. And if you're not on Thyroid Fixer yet or T3 Conversion Fixer, that's going to help push the reverse T3 down. Because if you are stuck right now, Deb, so if you're stuck right now on T4 only, and maybe you're not quite ready to join us in the clinic, make sure you're here at 2 p.m. Eastern, 1 p.m. Central, because I might just have an answer for you, Deb. I might have an answer for a lot of you at that time. So make sure you are back on here at 2 p.m. Eastern, especially if you are struggling with your doctor not writing the labs. Poor Deb had to buy her own, not writing the right prescriptions. Yes, Deb, you can do Metabolism Fixer too. Just get the T2 in there to push T4 to T3 conversion, because T2 will help. So that's in Metabolism Fixer and Thyroid Fixer. If anybody on here is struggling with their doctor, not getting the thyroid medication you need, not getting the bioidentical hormones that you need, make sure you're on here too. I'm just giving you a little sneak peek. All right, here we go. Let's move these over here. All right, Leslie Irvine. I love you, Leslie. You're always on here. How's it going? So pop on into the chat. Hi, Leslie. You're always on everything I do. So I love you so much for that. All right, my dear. So we can see that your free T3 is high, but honestly, I don't care, right? I don't care. So Leslie, can you pop into the chat real quick as we're going through these? Can you please pop into the chat how you are feeling? So what are your symptoms? I want to know your symptoms. So I want to know basically, are you saying like, oh my gosh, I feel great. I feel amazing. My energy is good. Or are you saying, or would you pop in and say like, oh my gosh, I'm still struggling with hypothyroid symptoms. What is happening? So I need to know exactly how you are actually feeling, Miss Leslie, because that determines a lot. And then the other big thing that I want everyone to know is when you should test. So, okay, Miss Leslie, you have frozen shoulder. Other than that, good. Except a lack of hormones due to birth control is pushing down your natural hormone production. Yes, you are correct. But other than that, you're good. Okay, so in Leslie's case, even though, breast cancer. Okay, you're avoiding hormones because of breast cancer. Okay, that's a whole other webinar. That I think, oh gosh, Leslie, you've heard me so much that it's an individual choice. It really is. Like, we will always provide you at the Advanced Thyroid Hormone Clinic. We'll always provide you with all the information. And then you ultimately have to feel comfortable with that. If you've had a history of breast cancer, as far as bringing in bioidentical hormones, but what I'm seeing here is that you are feeling pretty darn good. So, okay. I don't care about the free T3 being high. What I was going to say is it's also imperative of when you test. You want to test 18 to 24 hours, no medication before your labs. And we said that in the very beginning when we were kind of going through how to test and when to test. You want to test 18 to 24 hours with no medication before your labs. Here's why. Because if you're taking T3 of any kind, if you're on natural desiccated thyroid, Armour thyroid, NP thyroid, Ren thyroid, if you're on a thyroid glandular supplement, if you're on a compounded T4 and T3, if you're on liothyronine, if you're on Cytomel, even a baby dose like we saw earlier, it will artificially raise your free T3 levels so that it can actually look falsely high. You don't want that. When you are testing, you want those pure numbers. You want clean numbers. You want to know exactly how much T3 is left in your body after it starts to wear off. Now you'll say, well, wait a minute. Don't we want to test while the T3 is in us? It still is there. But I am telling you, if you test at the peak, like some influencers will tell you test at the peak. Some people will tell you take your thyroid medication and then go test. You will get a false high. You will get a false high. Now, Leslie, you've been with me for so long. You've been listening to me for so long. I know that you didn't stop, or you stopped your thyroid medication 18 to 24 hours before you took your labs. I know that you did, but let's say somebody didn't. Okay, reverse was included. It's 11. Thanks, Leslie. Yeah, I figured reverse would be included. Let's say you accidentally took your medication and then went for your labs. Then it would be oops, I'm getting a 4.33 and it's high, but that's not actually my number. Now, if a practitioner didn't know any better and they looked at that, they would tell poor Leslie that she's hyper ER. And that's not correct at all. Leslie is living her best life. We love that TSH suppressed. I don't care that that's suppressed. I saw somebody in the chat say, oh my gosh, you must feel horrible with the TSH that low. No, not at all. Not at all. Because whenever you're taking T3 of any kind, which Leslie definitely is, then you're going to have a suppressed TSH. Mine is 0.0007. So that is mine. Tammy, if it's 25 to 26 hours, you're going to get a little bit of a false low. I'm okay with 25. That's not horrible, but any more than that, you're going to get a false low. You're going to get a false low, and you don't want a false low either, because you want to be able to replace and do your proper thyroid hormone replacement the right way. So yeah, you don't want it too low either. All right. And just a couple of questions in the chat that are popping up. Yes, the book absolutely goes into thyroidectomy, post-thyroid cancer. Those without a thyroid, oh my goodness, yes, you can still benefit from T2. You need T2 because you no longer have a thyroid gland that produces T2. So you want to make sure that you take that to actually replace the T2 that you're no longer making because you don't have a thyroid gland anymore. Okay. Let's see. Okay, so let's keep going here and go to the next one. Devin, I know you're on here, Devin. I know you're on here. All right, so Devin has been in my life for so long, and I love her to death. So Devin, why wasn't your reverse T3 tested? Like, who ran these? Now I know that you stay on top of your health. You really do. I got to move the chat box over here. So I'm not overly concerned because again, you've been with me like in my world for so long, learning from me for so long that you know what you're looking at. So, and you know how to read your body too. But as we're looking at Miss Devins, her free T3 looks pretty good at a 3.4. You could use a little bit more though. You could use a little bit more, Devin. So can you remind me what thyroid hormone and dose are you on currently right now? And then are you experiencing any symptoms that we need to know about? So yeah, you already know that you have Hashimoto's. Thyroid peroxidase antibodies are a 16. I don't know if those have come down recently, but okay. So you asked your doctor, he's great, but he forgot to order it. Okay. So Miss Devin, then it really is kind of about how you feel. And I know that you are so, okay, you get it done Monday. You're so in tune with yourself. So this is a perfect example of you could have a TSH that's a little bit above a 2, a free T3 that we would say, oh, it's almost optimal. It's right there. This is where you have to go to the person and say, how do you feel? How do you feel? So Devin, how do you feel? How do you feel? You got it done on Monday. It's just not back in time. Okay. But how do you feel? You always have to go by how you feel, because when you're looking at these labs, you got to go, okay, so this person could either be struggling with a slightly elevated TSH and a not quite optimal free T3, or they could be rocking life and living their best life. So that we always have to go with how do we feel? All right. So Devin, I'm going to come back to this. I want to know how you feel. How do you feel? How do you feel? How do you feel? Okay. Oh, you're on. Okay, this is Dawn. Okay, less than 1. Yes, yes, yes. Okay. All right. I'm coming back to you, Devin. Maggie V. Miss Maggie V, are you here? Maggie V, Maggie V. Got my book now. Hi. Awesome. I love it. This would be Hedar Marie's computer. I just got your book. Thank you. Thank you. Thank you. Yes. We'll pop the we're gonna pop the link in the chat for YouTube and for our VIPs. In case you want to buy more books for your brother, your sister, your aunt, your mother, your neighbor, or your doctor. Miss Tammy, thank you for getting my book too. All right. I don't know if Maggie V is here or not, but let's use her labs as a beautiful example. All right. Miss Maggie V. Okay. Deb Doctor, you just got my book too. Thanks, Deb Doctor. Thank you, thank you, thank you. Okay. TSH, it's above where I like it. So TSH, we really like it below a 2. Maggie V is at a 3.85. So that right there, that's kind of screaming at us. And even if we look back in January, Maggie V had a 4.4 TSH. So we want TSH below a 2, a below a 2, a below a 2. So when TSH goes above a 2, then we start to get a little bit concerned about that. And we go, okay, this person is probably experiencing some hypothyroid symptoms. So we got to keep going. Martin, yes, if you go to betterlifedoctor.com, and I'll have Jamie pop the link into the chat. There's T3 conversion fixer and thyroid fixer. So I saw your question come through. I wanted to grab that. So Miss Maggie, you also have the presence of Hashimoto's. They're not like screaming at us with the antibodies, but any antibody is an antibody. So any antibody is the presence of a soldier that's going out and beating up your thyroid. So you have to think of antibodies just like that, of these little soldiers that are programmed incorrectly. In their programming, they think that your thyroid is a bad guy. They literally think it's like the enemy in a war. So what they do is they launch an attack. They're like, woo, let's destroy the enemy, right? Let's start a war. So whenever you see the presence of antibodies, like we see on Maggie V's, we see that her antibodies are 4, a 4, a 2. That is still the presence of 4 or 2 or whatever soldiers going out and beating up her thyroid. Now, she's done a great job at lowering her antibodies over time. Maybe she's on Hashimoto support by the fixer. That helps to lower antibodies. She's done a great job at doing that. But we also don't hang our hat on our antibodies. So I don't care if her antibodies were 1,000 or if they're 2. We still need to look at the rest of this thyroid panel to really get an insight into Maggie and how she's doing. Okay, Miss Jessica, the live lab read was for anybody that purchased 5 or more books. So we're going through those now. And then when we open up for Q&A, and if we have extra time, you can pop your labs into the chat with my VIPs here, and we will get to those. Anyone on YouTube, make sure you join the Just Fix Your Thyroid Facebook group, because even if we don't go over your labs now, you can pop them into the group. And my gosh, like I said before, I'm in there. My nurse practitioners are in there. All my people are in there. I have patients that have been with me for so many years that they literally know what I'm going to say. So they will answer you as if I'm like, yep, what Lisa said, what Angeliki said. You'll see them in there. You will absolutely love them. All right, back to Maggie. Free T3 is low. It is a 2.6. We want that free T3 to be in the upper quadrant of the range. That means she really needs to be like a 4 or 4.1, 4.2 or above. She is way, way, way low at a 2.6, way low at a 2.6. Her reverse T3 is okay. Any higher, and I would love it if Maggie B was on, I would ask her what thyroid medication she was on, because if she is on any kind of T4, we don't want to increase it. When that reverse T3 is an 11.6, we want to hold tight. We never, ever want to increase. Don't increase the NDT. Don't increase the levothyroxine. Do not increase your T4 when your reverse T3 is riding that border of a 12. We don't want to increase T4. Now, she got her totals done as well. Her free T4 looks decent. That lines up. But the really big concern with Miss Maggie is this 2.6 free T3 level. So if she was on here, I would absolutely say, oh my gosh, Maggie, we need to do something about it. We definitely need to do something about it. Okay, Jessica, we got these labs, and we don't have a last name for Miss Jessica, but I find these very interesting because once again, she does not have a reverse T3. And that is a huge problem when we're trying to get an idea of like what's going on with her. So Jessica is new to our Facebook group, and she actually started taking a GLP-1, and her thyroid and her Hashimoto's went crazy. Started in July, and labs were okay on Armour 30 milligrams, but after 4 weeks of tirzepatide, started having racing heart and irregular heartbeats, which that can happen. So I have an entire section in the book on GLPs and microdosing GLPs and how you need to do it properly. And we can actually see an improvement in your thyroid labs, an improvement in your thyroid function, but they have to be done properly. At the Advanced Thyroid Hormone Clinic, yes, we prescribe GLP-1s. We make that part of the program, but we educate you and we do it the right way. So we are truly doing a microdose. Unless you're a full-blown type 2 diabetic that needs the standard dose, we are doing a true microdose. We are teaching you the right way to do it because that is how you are going to get the benefits and not the negative effects. Now, even when you're doing it the right way, Miss Jessica might have been doing a very low dose, but some people will still get the irregular heart rate, the racing heart. That is actually very common. And oh my gosh, Jessica, NP sent me to a cardiologist who said I had AFib with RVR. Yeah, I have one other patient right now who literally can't take a drop of semaglutide because he goes into AFib. So, yep. All right. And then no one checked my lab, no one checked my labs and said because I was normal before the shot, it couldn't be my thyroid. I found a functional medicine NP who checked and said my results below in October could be causing my AFib. Okay, so Jessica, your functional medicine nurse practitioner is exactly what I was talking about before. She doesn't know the thyroid. Remember, how do we know whether or not we are working, especially if you're spending money on functional medicine or integrated medicine or any kind of, out-of-pocket payment system, functional, integrative, alternative, whatever, new age, I don't know. If you're paying somebody and they are giving you any kind of advice about your thyroid. So Miss Jessica's NP said her results in October could be causing her AFib. Number one, poor Miss Jessica's NP, who doesn't know what they're doing with the thyroid, is going off of her TSH and is blaming her low TSH for her feeling hyper. And she's also looking at her free T3 and saying, ooh, that's a little bit above range. That must be why she's hyper. And then I would ask Miss Jessica, do you feel hyper? Because your free T4 is a 1.8, and I would bet huge amounts of money that your reverse T3 is through the roof. But oh, wait, she didn't test your reverse T3. Remember, what is that? When they don't test your reverse T3, it's translation. I don't know what I'm doing with the thyroid. I don't know what I'm doing with the thyroid if they don't check your reverse T3. So she did not have her reverse T3 checked. I bet money that it's high. Jessica, you need to get away from this functional practitioner and stop paying them and just stop paying them. Marcy S. Okay, let me see. All right. So, oh, wait, Devin, I will come back to you. Okay. And they don't automatically. Okay. Yeah. Wait, Devin, I saw you posted in here. Now I'm trying to come back to you. He's great, but he's stumped to order it. All right, wait. I thought I saw. Okay. Devin, you said I'm feeling okay, but let's wait on me until I get my reverse T3 and I'll pop it into the Facebook group. All right. I love you. You're here the rest of the day. So if my results come in, I'll let you know. All right. That sounds like a plan. You know, I'm always here for you and you're in the Facebook group. Absolutely. All right. Marcy S, if you're here, just give me a yes. Give me a yes. Yes, I'm here. Let me see if you're here, Marcy. Miss Marcy. Okay. So Marcy, she has all of everything that we need to see except for the antibodies, but we can already see that her TSH is screaming. So TSH is saying, oh my gosh, Marcy has Hashimoto's, or that TSH being so high is just basically saying Marcy is not optimized right now. Whoever is treating Marcy, they are not doing a good job because the TSH isn't even down. Even a conventional medicine doctor giving T4 only, we can see the TSH go down, which is what we want. We want it less than 2, less than 2. Many people in the chat are saying, I don't feel good unless my TSH is low, right? Okay. So TSH, we want below a 2. This is screaming at us. Free T4, 1.1. That's not too bad. Her reverse T3 is right at that borderline, right at that edge. We don't want her going up in her T4 any more than what she's already on. But what we do need is T3. Her free T3 is a 2.5. We know, and what causes high TSH, Terry, is just not being on the proper thyroid hormone replacement. I mean, TSH is when your brain is screaming at your thyroid, wake up, let's go, let's start producing thyroid hormone. If TSH is high, it's literally your brain saying there is not enough thyroid hormone here. Your thyroid is not doing a good job. This is bad. So the other thing that can cause a temporary high TSH, Ms. Terry, is when you start taking iodine, you can get a little bit of a bump in TSH, but we can see Marcy's free T3 is low. It's very low. It's a 2.5. Okay, Miss Leah, I know I always see you in the Facebook group, Leah. So let's see if you're here. Give me a yes. Give me a yes. Okay. Yeah, Terry, your brain is screaming then. Yeah, unless you're taking iodine. And really, that's a temporary bump. When iodine bumps TSH up, it's a really temporary bump. So if you're getting elevated TSH levels ongoing, then that is a sign that, yeah, you are not optimized. No iodine, TSH is 5.49. Yes, Miss Terry, you have screaming hypothyroidism, Hashimoto's, screaming. Okay. Here is Leah. So her reverse T3 is a little bit too high. But again, her free T3 looks really darn good. So this would be the perfect profile of someone, and her free T4 is a 0.8, optimal. Free T3 is 3.8, optimal. Reverse T3 is just slightly above. And then, we have the T4 totals, which we don't really care. She does have the presence of antibodies. This is a profile for Hashimoto's. Don't look at what the standard lab value range says. But again, we don't hang our hat on our antibodies. We don't say like, oh, Leah must be feeling horrible because she has antibodies. No, we say, Leah, make sure that you're taking Hashimoto support by the fixer to lower the thyroid peroxidase antibodies of 39. That's easy breezy for Hashimoto's fixer to do. And then I would say, how do you feel? How do you feel, Leah? Because this thyroid panel looks good. The reverse T3 is a little bit high. But the other thing that I say is I will accept a reverse T3 under a 15. So between a 12 and a 15, if free T3 is optimal and if that person feels good. Teresa, I answer that question in the book. So it's kind of a maybe. So sometimes thyroid medication is the way to move your labs into the optimal range and reduce your symptoms. It all depends on where you are in the process. And I get this question all the time, so I'm going to stop and answer it right now. Here's the thing about thyroid hormone replacement or thyroid medication. I want you to think about it in the hormone replacement category. A lot of people think, and I'm speaking to all of you right now. A lot of people think that if I'm going to stop sharing on YouTube here too. Okay. Because then we're going to go into, I got it. Good. A lot of people think of thyroid medication as like a bad connotation, right? I don't want to be on medication. I don't want that little orange pill bottle. And I understand that. I get that. But I need you to think about it differently, because the medication that you want to avoid, those are the Band-Aid meds that your doctor will prescribe. Those are the antidepressants, the statins, the sleeping pills, the high blood pressure medication, the high dose ibuprofen for your frozen shoulder and your joint pain. Those are the medications that no, we don't want to be on. Absolutely not. But when it comes to thyroid hormone replacement, we're putting it in a different category. We are putting it into the category of thyroid hormone replacement. Just like we take BHRT, we take thyroid hormone. And that beautiful thyroid hormone gives us life. that beautiful thyroid hormone replacement actually keeps you off of the Band-Aid medications that you don't want to be on. And I promise you, when you are on the right thyroid hormone replacement, i.e. thyroid medication for you, at the right dose for you, in the right combination for you, that yes, it moves your labs, but you know what it also does? It moves your symptoms and it gives you your life back. You know what you will say? You won't be asking, can I get off this medication? Is there a way to do things naturally? Instead, you will say, you will have to pry this thyroid hormone out of my dead cold hands before you take it from me, because this is what's giving me life. And this is what I say. This is what our optimized patients say all the time, because once you get there, you don't ever want to go back. Once you get relief of the symptoms that you are struggling with right now, and many of you have been struggling for years, if not decades, once you get that symptom relief and literally experience what it's like to be in optimization land, you will never go back. You will never give up that thyroid medication, because you know that that thyroid medication is protecting you. That thyroid hormone replacement is fueling your cells and fueling your metabolism and lighting up your brain. And here's the other thing, and I'm going to say it right here. I talk about it in the book, but it is worth saying. You know, we went through all of those symptoms in the beginning, and I focus on the aesthetics. We focus on the weight gain and the hair loss and the eyebrows and the dry skin and the cracked elbows. And nobody wants to be bloated and walking around like they're 6 months pregnant. Nobody wants to be constipated, and no one wants low energy, and no one wants to be depressed or anxious or any of that. But what about our life? What about what is keeping us alive? What about diseases? So the bottom line is, and the reality is, if you do not get your thyroid optimized, you are at a greater risk of neurological diseases of aging. This is Alzheimer's, dementia, Parkinson's. A recent study just came out in the last couple of weeks that showed that low functioning thyroid, and this can be you walking around with a thyroid condition that you're not diagnosed of, or this could be you on the wrong thyroid hormone replacement, that puts you at a statistically significant increased risk of Parkinson's. Parkinson's. So we don't want that. Alzheimer's, there are T3 receptor sites on your brain. You are at an increased risk of Alzheimer's when your thyroid isn't optimized. Heart, cardiovascular disease is the number one killer of women. The number one killer of women. Why do you think people are getting ablations, being put on beta blockers, experiencing AFib from hypothyroidism? How do you think that's affecting you in the long term? Your long-term health. Lipid panels. Everybody's getting a cholesterol panel done by their doctor, right? Those lipid panels that your doctor goes, oh my gosh, you need a statin. Do you? Or do you just need to optimize your thyroid so you don't have to be on a statin that steals your quality of life and rips away your hormones? Because everybody on a statin has low testosterone, men and women. What about cancer? What about cancer? Now, I know you see IG influencers out there saying, Synthroid causes cancer. And I go, wait a minute, time out. You know, I love busting myths and busting lies, especially of male influencers out there that are standing on podiums telling you that you don't need thyroid medication or thyroid treatment. Just take their supplement, do their protocol, or address your COMT gene and you'll be fine. That's not the case. Okay, that is not the case. However, I love bashing these practitioners. But anyways, on the cancer side, you'll see Synthroid causes cancer. It's not that Synthroid is carcinogenic. But if you walk around with a non-optimized thyroid, you are absolutely at a greater risk of cancer. Why? Because it starts affecting your immune system. And your immune system is constantly surveilling, constantly on the lookout for these funky mutated cells. And as you're sitting here right now, your immune system is killing cancer cells. FYI, whether you know it or not, your immune system is killing cancer cells. If we do not have an optimized thyroid, our immune system does not work properly. Your surveillance system does not work properly. And that, my friend, is what increases your risk of cancer. So this is something to be taken seriously. It's not just about aesthetics. It's not just about feeling good and looking good in our jeans. This is about longevity and your life. So it's not something to be taken lightly. Okay, so we are ready for our guest expert. grab a sip of water, bringing her all in. Pin, right? Pin, right? Pin. Pinning Karen will remove all spotlighted videos. Okay, that's fine. You can just pin me then. Pin myself with Karen. Here we go. My dear friend and colleague, many of you know her, Karen Martell. Oh, Karen, yay. Thank you for joining us today. Love it.
Thank you for having me, Amy. I got to talk to you yesterday in my group, and now I get to talk to your group.
I know. We have so much fun together.
It's great.
Literally, I only brought on one expert. We need her on here. Oh, no, I guess these people don't get to answer or see their, they can't see her. YouTube can't see Karen.
So
it's only my VIPs.
Link, they can hop in for 20 minutes.
Okay. Okay.
I'll give them the link.
All right. My YouTube peeps, because you don't get to see Miss Karen Martell, and this is very, very important. You are actually getting a link to pop over into our Zoom room and hang out with Miss Karen so you can ask questions as well. So, I only brought on one expert today, and it is Karen because
I'm honored.
Yeah, right? Because you and I think so much alike. We bounce ideas off of each other all the time. Karen is incredibly knowledgeable about hormones. I mean, the amount of times that just yesterday, I'm pinging Karen a question. I'm like, okay, I got one for you. So I just absolutely love when you come into my community and start sharing your knowledge, and you have your own thyroid story too. So you're an expert in hormones and thyroid, which I love.
Oh my gosh. Yeah. I went through hell and back with my thyroid, and I'm so knowledgeable about it because I couldn't find this information. Even my naturopath, who was fantastic, was still limited to what he knew. And so I just went down the rabbit hole for years, just trying to help my own thyroid. And it took so long that I was like, oh my gosh, I have to start coaching women because we are not being told the correct information.
Yeah.
And so this is how I got to where I am today. But same as you, I had the reverse T3 problem, was put on the wrong medication, put on armor, and felt amazing because it was the first time in my life that I had actually been not properly, but treated for thyroid.
Mm-hmm.
And it was about 2 months in, and I suddenly just hit a wall and had the worst hypothyroid symptoms I had ever had.
Yep.
Thinking, okay, well, maybe I'll just have to move up in my armor dose. And I said, do you think you could test my reverse T3? Because here in Canada, we actually don't have a lab that will test reverse T3. So for all of you Canadians that are here, you actually have to have a naturopathic doctor get the requisition for you specifically for reverse T3. You have to pay out of pocket for it, which is not much, it's like $30. And then they'll actually send it to California to be tested. But it can be done.
It's crazy.
And my reverse T3 was at 19. And so that's it. What had happened is my body was like, oh, this is amazing. We're finally getting some T3. I didn't need T4. My T4 was fine.
Yeah.
But I didn't know then how it all worked. So I started adding in this armor. T4 started going up, but T3 did too. Felt amazing for about 6-8 weeks. Crashed and burned because that T4 was shuffling into reverse T3 and going up. And I was still in range at 19. And then I switched to a T3 only and recovered. But holy, was that hard to figure out how to do on my own.
Yeah. Yeah, no, it's really hard to figure out how to do on your own, because I even think it's hard to think for yourself as a practitioner. And this is where, I'll lean on other people like yourself to help guide me with hormones. Like, I'm good with thyroid, but then you second guess yourself. You're like, can you just take a look at this?
Yes.
Can you just take a look at this?
Yes.
Tell me if I'm doing the right thing. It's so hard to think for yourself. And then if you are one of these amazing people who have been listening to me, have been listening to you, they're taking in all of the information and they know what they need to do, but then they get stuck. That's even more frustrating, It's like they
Yes.
know that they need less T4 and more T3, but just like when we were going through the lab reads earlier, you know, there are people typing in like, I had to order these labs myself. My doctor won't even prescribe more than 5 micrograms of T3. My doctor won't prescribe any T3 whatsoever. And that really is the frustrating part. It's like when you know what you need to do, and then you can't get it.
And then and I'm sure everybody here can relate to this, the fear of going into your doctor, your family physician. You get so nervous. You rehearse the conversation over in your head over and over and over again, because you're so nervous to say, hey, actually, what you want to say is, you don't know what you're doing.
Yeah.
I do. Could you please, prescribe this to me? No doctor handles that well.
Right.
And so you get so nervous. I remember hiding my thyroid from my doctor for so long because I knew she would have freaked out if she saw my numbers. But my naturopath was on board with me. So I just continued going to him and was always worried about the doctor going, if she finds out I'm on T3 only, she's going to lose it. And she would have.
Yeah, exactly. And this is where too, I was talking earlier, Karen, about hypothyroidism, or I'm sorry, taking your medication before you go for your labs and how that can bump up your T3. So, you and I have talked about this before. There's a lot of practitioners. Well, there's a couple of practitioners out there that are saying, take your thyroid med before you go for your labs. But then what happens if you're working with, let's say, a conventional doctor or OBGYN or a functional doctor that doesn't know what they're doing, and they see your free T3 elevated after you take your medication? Did that happen to you?
Oh my gosh, yes. And so now I always okay, I'm going to leave it for 15, 24 hours, somewhere in there, where I try to, not take it for that amount of time and then go for my labs. And you do want it sucks that we have to do that, because you feel like, you're lying. Like your physician's like, take your medication the morning of and then go get tested 4 hours later. But then I always say to our patients, I'm like, it will overshow. If you're on tirzepatide, which a lot of thyroid patients are now, it slows down the absorption of it. So then you have to actually take that into account now too, if you're on a peptide. Yeah. Because it'll, you might want to wait more than 15 hours, 18 hours and go 24 hours before. Yeah, I always say 18 to 20. Hey? Yeah, 18 to 24. 18 to 24.
Yeah. But that's a good call on the GLP. Yeah. Yeah, especially if you're working with a doctor that doesn't know what they're doing. You want it to undershow, so you want to go longer than 24. Okay, I want to get to the hormone questions because we have some coming in for you. Anyone that has any kind of question for Miss Karen, she is absolutely a hormone expert. Just pop it into the chat. Pop it in the chat. All right, so let's go.
I see one from Rhonda here. I don't know if that's the first one, but
go ahead and read it because I'm scrolling through all of them.
I went into surgical menopause 30 years ago with no hormone support. With the new HRT data, no doctor will still consider me for BHRT. Is this the right guidance? I have osteoporosis and I've had an AFib ablation. I've lost so much weight.
Yep.
Oh no, I've lost so much weight out hormones.
Without
maybe you've gained weight without hormones, or either way. Okay, so when it comes to the old advice, which is you shouldn't take HRT past 10 years postmenopause, start it or continue with it 10 years postmenopause. That information was based on old HRT, specifically oral Premarin estradiol. So that was the old HRT that came from pregnant horses' urine. It is not like ours. It's not bioidentical. When you're taking it orally, any form of estrogen orally, you are going to be at an increased risk of heart attack and stroke. And what they saw in the research was past 10 years was when they started to see that becoming a problem and that risk would start to go up. So they used to say every woman come off of it. They no longer advise that. And they say if you are on a transdermal estrogen, that could be injection, cream, gel, vaginal, there is no increased risk of heart attack and stroke. And the Menopause Society has come out now a couple of years ago and changed their stance on that and said, you can now stay on HRT if it's transdermal estrogen for as long as you want. And I will take it into my grave with me, because as soon as you stop those hormones, you will lose those benefits fairly quickly. You'll still have the benefits of when you were taking it, you know, the protection on your bones and your heart and your brain. But as soon as you stop it, that protection is now going to end. And so when you are post-10, you're like this woman, what I would advise doing is working with a practitioner who is open to prescribing HRT to you, because there are lots now. And you just want to go low and slow. Your hormone receptors have had zero hormones for a very long time.
Yep.
They're going to be ultra sensitive. So when you start, you have to start in very small doses and slowly titrate your doses up until you're optimized. And everybody's different. Some people, it takes 3 months to get them to the dose they should be on for that protection. But low and slow, pay attention to symptoms. If you get tender breasts, bloating, etc., then okay, I got to hold off on titration and wait till my body adjusts, because you have to wait for those hormone receptors to go, oh, okay, there's hormones. We don't have to be freaked out and super ultra sensitive anymore.
Yeah.
We can just act normally.
And I've seen that. I mean, we've had some patients come into the clinic that are in their 70s or even in their 60s, and they've gone, oh gosh, 10, sometimes 15 years without hormones, because they were part of the Women's Health Initiative study. They ripped the hormones out of their hands, or they were told that hormones cause cancer. And so even that, like those 10, 15 years, we see the same thing. I always use analogies. It's like, those little baby birds in a nest when they're new and they're like open with their mouth, like, feed me, mama. It's like, that's what your hormone receptors are if you've gone that long without hormones.
Exactly. So yes, it can be done. Absolutely. Okay. So
wait, there was one earlier, Karen, that I left up because I wanted to get to you. The tie-in between hormones and thyroid, like how hormones and thyroid affect each other. We're going to be going into this much more detail at 2 p.m. Eastern, 1 p.m. Central. You want to make sure you're on here for that. But I want to hear from Karen. Yeah. Can you tell about that tied in?
Absolutely. So we see, and we've worked with so many women, as has Amie, where we see women who have never had a past of like any sort of hypothyroidism in the past, have never been diagnosed with it. So they think, oh yeah, my thyroid's fine. I'm just in perimenopause. And then you look at their thyroid numbers and they are not optimal. And so we do see, I don't know about you, but I see about 50% probably of our patients that start to have a slowed thyroid from the drop of the sex hormones.
Yes.
They don't work by themselves. They're not working in silos. They are working together. They all affect each other. Progesterone drops first in perimenopause. Progesterone helps your thyroid to work better. Even estrogen, there's a little controversy around the estrogen because estrogen can raise thyroid binding globulin, but that is mostly the oral estrogen. And estrogen can actually help your thyroid receptors to be more sensitive. Testosterone, they see in research, can actually help with Hashimoto's on the immune system. So all insulin's going to affect it and vice versa. So they go back and forth with each other.
Yeah.
You always want to address both. And if it's just on the slight low end, optimize that progesterone, that estrogen, that testosterone, especially if you've never had a history of thyroid problems.
Yes.
Optimize those first. And if the thyroid then is still under functioning, then you can address it. But some people, it's so low and they have absolutely hypothyroid symptoms that you need to treat that right away because they just don't feel well unless you do.
Yes. And, we talk about thyropause. I have a full chapter on thyropause in the Thyroid Fix. And this is really where, just like Karen was saying, when your hormones start to shift, when we enter that perimenopause state, and even Mary said that is when my subclinical hypothyroidism was diagnosed during perimenopause. When we enter that state and our hormones start to shift, decline, go on a wild roller coaster ride for a while before they decline, before estrogen falls off a cliff, that affects the thyroid. And oftentimes we see it's almost like a switch that's hanging out in the off position and it gets flipped on. And now a woman has double the amount of symptoms because she has the symptoms from the declining hormones, but she also has the symptoms from low functioning thyroid as well. Yeah. Okay. So, oh my gosh, there's so many questions coming in. What about this one from Tammy?
I like this one.
Yeah, go for
Can
it.
progesterone increase insulin resistance?
I see that a lot. Yes, go.
Yeah. Yes. Yeah. So this is an interesting one that not a lot of practitioners know about, and it's more from clinical experience rather than what's in the research. But what we see is that too much progesterone for some women actually can increase insulin resistance. But on the flip side, too low will also increase insulin resistance, not as badly as estrogen. Estrogen has way more effect on insulin than progesterone and testosterone, but we do see it in a very small select group of women where they're on too high of a dose of progesterone, and sometimes it's for women that take high doses every single day and they're not taking a break from progesterone. We have seen it increase insulin resistance. And there's a little bit of information about it, just not a lot. And so, yes, absolutely, it can happen.
Yep. Okay. Can you talk about this woman, Margie, had breast cancer in 2014, has been using estriol cream, which I know you have in your line, Karen, since then to alleviate any UTIs. She was progesterone positive and estrogen receptor positive for the breast cancer, which that's a whole other topic of hormones don't actually cause cancer. They're not contraindicated after breast cancer. You really want to listen to Dr. Lindsay Berkson, Dr. Jen Simmons, Dr. Julie Taguchi. Yes. We have both had them on our podcast. So that's another, Margie, that's a whole other question. But can you talk a little bit more, Karen, because you're so knowledgeable in the estriol world, how estriol can help with UTIs, vaginal dryness, or our skin?
Yes, it can. And it's great for that. Estriol is a very, very weak estrogen. It's not going to give you the protection that estradiol does. And it's very concentrated in the vaginal tissue. And so it can really help with that. And also for the skin, you want to put topically using estriol in the skin can be fantastic. But what I would advise is working with somebody like Amie and her team. Amie and I work with one of our physicians networks that we work with, do work with women that have a history of breast cancer. It's really hard to find a doctor that will do that. And we do offer that at our clinics. And so work with somebody. I mean, this is a personal choice, of course, and you probably always want to try and get your oncologist on board with it. But when you look at the research, it does show that women that use HRT post breast cancer with certain breast cancer types actually have less reoccurrence if they optimize their hormones afterwards, and that includes the estrogen. So just keep that in mind, and talk to somebody that's open to prescribing it to you, because some doctors are.
Okay. Yep. Absolutely. Thank you. And Karen has amazing products in her line.
Ours is an estriol DHEA over-the-counter vaginal moisturizer. It's called Velvet V. And the DHEA will convert a small amount into estradiol in the vaginal tissue, but it's at a low enough dose and you don't use it every night that you don't have to worry about it raising levels. And it's got a DHEA and estriol in it. And we have had amazing success with that. And there's no crap in it, which I like to point out, because what you get from your pharmacy for vaginal cream, questionable ingredients.
Oh, interesting. That's good to know.
Yes.
That's good to know.
Yeah.
So even some compounding pharmacies can have like, not so.
Most.
Oh.
They're not going to use like great ingredients. Like we use shea butter. We use products that don't have any parabens, nothing synthetic in them. You won't find that in a compounded cream because those ingredients are usually too expensive. So ours, we made sure that it was safe for the microbiome of the vagina.
Beautiful. I love that. I love that. A lot of progesterone questions. So we're going to kind of lump them all together. Is there too high of a dose of progesterone? And then that whole question about taking a break. Should we take a break from progesterone?
Yes, this is a hot topic.
Hot topic.
Hot topic. Women actually get mad because they get different viewpoints from different physicians. And here's the bottom line. I have researched this so much. Like, should we be cycling? Should we not be cycling?
Yeah.
Unfortunately, there isn't enough research, but there is a little bit. Like Dr. Doug Lucas, the bone guy, there is a new paper that shows cycling progesterone is better for your bones than using it every day. And so the thought behind that is when we're cycling women, we only produce the bulk of the progesterone in the second half of the cycle after ovulation. You have to ovulate in order to be able to produce the bulk of the progesterone. We do convert a little bit through many different pathways, but it's not enough. And if you look at somebody's levels in the first half of their cycle, you would see that. It would look like their progesterone is really low, and then they ovulate and it comes up. And so we try to mimic Mother Nature as much as we can, which, no HRT protocol is doing what Mother Nature does. Come on, let's be real here. Our hormones are very sophisticated, but we try our best. And if we want to kind of go, okay, Mother Nature doesn't do anything by mistake, so why don't we try to follow it as best we can? And so what happens is when you're on HRT, and you're in menopause, you would take progesterone for only 2 weeks out of the month, but you would take estrogen or testosterone every day because that is what your body naturally would have done. Now, when you look at why or what happens when progesterone kicks in when we're fertile, so on day 12 of the cycle, our estradiol and our testosterone actually bump up because they want you to go out and have sex before you ovulate. So we have our highest peak of estradiol throughout the cycle on day 12. And this causes this tumor suppressing gene to be suppressed. And then progesterone comes in and it actually helps it to kind of do this rebound effect where it pumps up and you get the tumor suppressing gene, which I think we all want the tumor suppressing gene to be active. And so when you look at the signs of what happens during the mid-cycle peak, so some women will spike their estradiol once a month, and then they start their progesterone the day after to try to mimic this suppression and then this bounce back of this tumor suppressing gene. Has there been any research done on this? No. It's just we know that that's what's happening. So some women will say, yep, I feel better when I cycle my progesterone. Some women, if they're put on a really high dose of progesterone, and I'll get to what that is. If you're on a high dose of progesterone every single day and you're just on this kind of low estradiol dose because you have a doctor that's afraid of using estrogen and it's all about the progesterone and is like, yeah, take boatloads of progesterone every single day. What can actually happen is it can lower the estrogen. It can outcompete the estrogen. And so we'll actually see estrogen going down and then progesterone continuing to go up, which we don't want. We want all the estrogen we can get in menopause. It's the most important hormone out of all of them, if you ask me, because it has the most impact on the entire body and all the really important things like brain, bone, skin, etc.
Yep.
So high dose progesterone, I would say with the oral progesterone, I do not like seeing it go past a 200 milligram dose. There's the occasional woman that needs to get to like 400 in order to get the benefits, in order to get good sleep from it, which is okay, but you are then going to be producing a lot of progesterone metabolites, because when you swallow progesterone, it has to go through your digestive system, has to go through the first hepatic pass of your liver. And that means you're going to lose a lot of the actual progesterone. You're only going to get about 20% of that oral progesterone when you swallow it. And then you're going to have the rest that's going to turn into these metabolites that help you to sleep. But that can be too much. It's very sedating for some women. So even some women can't go past 100 because they get so tired. They can't wake up the next day. They'll get weepy. They get depressed because it's too it's going to really affect those GABA receptors in your brain, which is very anti-anxiety, but it can be too much for a lot of women. There is one researcher that said, a Canadian researcher that said, he was seeing anything past 200, I think it was even 150, it could cause a little bit of breast inflammation. And we don't want breast inflammation. Now, have we seen this actually show up for people where they were getting an increased risk of breast cancer with oral progesterone? No, we haven't. So all of that said, I always tell women, if you feel like you need more progesterone, or you're not absorbing the oral, or you're being affected by the oral, use transdermal progesterone, either in conjunction with a low dose of oral, or just if you're really sensitive to the oral, then switch to transdermal progesterone. It won't show up well in labs, but it does protect the uterine lining. And we have a ton of women on transdermal-only progesterone. I myself am sensitive to oral. I've always been on transdermal progesterone. I have a very great uterine lining. It's totally protecting the uterus. And so that is kind of the answer to people that are overly sensitive to the oral progesterone, which we're seeing more and more of.
Yeah. Okay.
So does that answer the question?
Oh yeah, that beyond answers the question. I love it. Yeah. Yeah. And no, I'll just add, just for the people, because I don't want the ladies that are taking 400, 600 to freak out. Cause I mean, both of us have those random outliers where that woman needs higher doses of progesterone, or she is an anxious mess. So, or she can't sleep. Yeah. So you outliers, it's okay. This is just in general. And
here's what I always say, because women will freak out and be like, I'm not cycling my progesterone. Should I be cycling it? Listen, majority of hormone practitioners prescribe progesterone to be taken daily, which means we have had millions of women around the world for a very long time, decades, taking their HRT every single day. Yeah. And they're thriving. Right. So keep that in mind. Right. So this is for somebody that's maybe just wants to be a little more nuanced, or maybe what their regime that they're on right now isn't working for them taking it every day. They're not feeling the estrogen enough. Whatever it might be, it could be something you could play around with and say, okay, I'm going to cycle for 3 months and see if I feel better, if my numbers get better. Yep. And you can do that. But nobody panic. So many women are on this and thriving. It's just some women aren't. It's just like high doses, doing a Wiley protocol. Some women need really high amounts of hormones to feel their best. Rather, other women who are ultra sensitive need really low levels of hormones to feel their best. Yes, absolutely. And I see some people putting in here the name of the cream. Some people jumped in. It's Velvet V. And then the product name for, you do have a progesterone as well, over the counter. She has a progesterone melatonin combination, which is absolutely beautiful for sleep. And that is the transdermal as well as on oral, it's a transdermal. So that's amazing. One last question for you, Karen, because I really want to get your take on this before you go.
pellets. I see a couple of people in here saying, I'm on pellets. My testosterone raised to crazy levels. I'm losing my hair. What about pellets? I want to get your opinion because I have an opinion on pellets that I'm pretty open about, but I want to get your opinion as well.
So once again, there is a very large group of women that absolutely love their pellets. I do not like them because they give super physiological dose, like really, really high amounts in the body when you first get them inserted.
Yeah.
Do not believe them when they say it slowly releases throughout your 3-month time period of when you have those pellets in. We've checked people from the start of the pellets to the end of the pellet cycle, and they are so high. You got male levels of testosterone for the first month, 2 months, and then it'll start petering off. Some women run through their testosterone really quick. And so what will happen is they get this massive dose when they first take it, then and they feel amazing. Heck yeah, it's like lots of testosterone. You feel really good and you're going, oh, is this what a man feels like? This is really unfair. Your sex drive goes up, you've got lots of energy, you feel like woohoo. But then it can drop really quick if you metabolize it quickly and you crash because you were on a steroid high. And so that is not healthy, and it's very, very far away from how your body would normally produce testosterone and how much your body would produce. And so we just don't see it being a first choice. If somebody decides, I think later, like I can't stick with the injections or I can't stick with the testosterone cream, I want to try pellets, go for it. Just do put a small amount in and you never want to start with pellets. No. Because once they're in, you can't get them out. And if you don't know how your body responds to testosterone, like myself, if I had ever done pellets, I would have lost all of my hair and I would have looked like I was a 13-year-old teenager with pizza face because my body has such a hard time metabolizing testosterone, and I'm a high converter into what's called DHT, which is a very androgenic testosterone, where you're going to get a mustache, you could have clitoral enlargement, you could start having voice changes. And if you have pellets in, you can't get them out.
That's it.
I've
You're
had
stuck.
Women gain like 20 pounds in 3 months with water retention and losing their hair, and there's nothing they can do.
Yeah.
Because those pellets are in there. So never start with pellets until you know how your body responds and what your perfect dose is. And then if you absolutely must, then after several months of doing that and finding your dose, then you could try the pellets. But it is definitely my least favorite way of giving testosterone.
Yes. Thank you for that. Because I agree 100% completely. Pellets and we're going to be diving more into this at 2 p.m. Eastern, 1 p.m. Central, diving into the delivery methods for hormones, because that is key. That is key. So some people were asking about testosterone cream in your line. No, testosterone is a controlled substance. So there's no way to get that.
Like a narcotic.
Over the counter. Yeah. It's literally in the same category as narcotics. You have to be working with a doctor that has a DEA license and can prescribe it to your state. So, oh my goodness, Miss Karen, thank you so much for your time today and for bouncing on here and for your knowledge. She has an amazing podcast. What's your podcast? The Hormone Solutions podcast.
Actually, and our podcast together just came out this morning, which is exciting. So
there you go.
It's a really great episode. So I know you're going to learn a lot here today, but I think it's still worth listening to.
Absolutely.
Amy's always got something brilliant to say. So the podcast is the Hormone Solution Podcast. You can just type it into iTunes and it'll pop up.
And it'll pop right up. Yep.
Yeah. Or my name, Karen Martel.
Absolutely.
Yeah.
Well, there's a ton more questions. I wish we had more time, but Karen's been on my show. She's a guest in all my group, like all the time. So if you follow me, you'll hear from her, vice versa. Yeah. We're on each other's podcasts. She's absolutely amazing. So Karen, thank you so much for your time today. You know, I love you.
Thank you for having me.
Thank you. Thank you for everybody for your questions with Miss Karen. That was a ton of fun. So I hope you're getting a boatload out of this. We are getting some questions that were in the chat, And then we're going to deep dive into supplements. So any supplement questions that you have on either end, my YouTube peeps, my VIP peeps, any supplement questions that you have, I want to go deep because I want to make sure that you're on the right protocol. My belief in supplementation is less is more. I am not at all one of those practitioners that load people down with supplements. I got to tell you, every single time I would sit down and do a one-on-one with a patient, we have them fill out their supplement protocol, like what they're taking now. And I can't tell you the amount of people that are taking something that they literally have no clue why they're on it, that their doctor or somebody, a health coach, a nutritionist, whatever, a chiropractor told them to go on it. And they don't even know what it's supposed to do or why they are taking it. So I really want to unpack supplement protocols, what you absolutely need to be on for you, and really go over what that protocol should look like, especially if you have hypothyroidism or Hashimoto's. Again, I go into it in the Thyroid Fix. If you haven't picked up a copy, grab the Kindle version, grab the Audible. In the Audible version, I give bonuses at the end of every single chapter. So you get extra info from me that didn't quite make it into the book. And I love explaining. I love deep diving. The link is in the chat. Make sure that you grab your copy of the Thyroid Fix today. The other thing that does, number one, it shows me love and support. So I love you for that. And thank you. But you're also, believe it or not, and this isn't like some kind of like pitch to you to get the book. It actually sends a message to Amazon, Target, Barnes & Noble, my publisher, that, oh my gosh, we need to print more of these. We need to get this out more. And it, it's just like any kind of like, it's like your IG algorithm, right? It sends it out to more people. We collectively, everybody here, we are right now a team. So everybody in the Zoom, everybody on YouTube, right now, we are like a big team. And yeah, we want to help ourselves because it flat out sucks to deal with symptoms, but we want to help other people too. Because especially if you have been where I was, if you've been in my shoes of being misdiagnosed, of dealing with symptoms, of losing years of your life, decades of your life, you know how hard this journey is. And that is literally why I wrote this book. That is why I wrote the Thyroid Fix, because I wanted to this Bible, this handbook, this is the handbook I wish I had when I was being misdiagnosed 6 times. This is what I wish I had in my hands at the time, because I wouldn't have wasted so much time of my life. I would have known what to do. I would have known what to ask for. I would have known how to find the right doctor. I wouldn't have bounced from doctor to doctor or endocrinologist to endocrinologist in the conventional medicine system, wasting months and years of my life. So we want to get this out there to every single person suffering. It's mainly women, but my guys out there too, you guys that have hypothyroidism or Hashimoto's, you get hit so hard, it starts affecting your testosterone levels, and it's just horrible. It is just flat out horrible. So that is why your purchase of the Thyroid Fix literally does help other people. Whether you know it or not, you are participating collectively in helping other people and helping other people not be dismissed, not be medically gaslit. You're empowering them to stand up for themselves. You're taking the time right here to be here and learn from you. And I freaking love you for that. I think it's amazing. It is amazing. And we have to help other people too. So you participating in this, buying a copy of the Thyroid Fix, believe it or not, you are helping other women out there suffering right now, truly, truly suffering. You're helping the woman that's not getting dressed and going out with her friends. I know, because I was there. I didn't want to put on clothes. You're helping the woman that is literally so depressed because she's counting the hairs that come out of her head in the shower. You are helping the woman that doesn't want to be touched by her partner because she is so embarrassed in her own skin and doesn't even know what she looks like in the mirror anymore. You are helping those women. All right, now I'm here to help you. So let's do this. Let's do this. Okay. Okay. So let's break down. Oh my gosh, so many supplement questions here. All right. Let's break down first the no duh thyroid supplements, because that's going to address a lot of these questions in here. So let me give you that, because that will help. And then we'll kind of get into really nitty gritty. Like, yeah, we'll get into all of these. Okay. So first of all, when we're talking about just the general supplements that I really do recommend we all be on, but especially if you suspect that you have a thyroid condition, or if you know that you have a thyroid condition, these are called, and I name them in my book, I call them the no duh supplements. And I'm totally dating myself, I know that. But for my Valley girls of the 80s, duh, of course you're going to take these supplements every day, right? So this is going to include, number one, magnesium. So in the Fixer line of supplements, we can pop the link in the chat too. We have a quad mag that is giving you 4 different magnesiums in one. Very, very rare, because most magnesiums are sold separately. Like magnesium citrate, that's going to help you poop every day. You know, you can buy these individually, or you can buy a combo product. I like the combo products because that way you are hitting the multiple impacts that magnesium does. So magnesium helps us to convert T4 to T3. It helps us to take our inactive thyroid hormone and convert it to active. It also helps relax our muscles. It helps with sleep. It helps calm our brains. It helps with gastric motility. So especially if you're dealing with constipation, with hypothyroidism, you want to add in magnesium. Most of us are magnesium deficient, by the way. So magnesium is number one. Selenium in the form of selenomethionine. Now we have this in T3 conversion fixer. So especially if you are on T4 in the form of levothyroxine, Synthroid, NDT, you know, your Armour, NP thyroid, Ren thyroid, still 80% T4. Or if you're taking a thyroid glandular over the counter, which I see some of you do, that is still T4. That is still 80% T4. I saw someone earlier say that they take a thyroid glandular. That's the only way they're getting their T3. Yeah, but it's still T4 as well. So we want to make sure that you're taking that T4 that your thyroid gland is producing, or that you are taking orally as medication. We want to make sure that you're taking that T4 and converting it over into T3. And this is where T3 conversion fixer comes into play. It has selenomethionine in it. You don't want too much. All my thyroid people, I know what you do. You think that more is better. You think that more is better. And you take 200 and 300 micrograms of selenium, and you read it on a blog, so you're pounding the selenium. That's not going to improve things. You want the right amount of selenium in the right form, selenomethionine. That's going to help with T4 to T3 conversion. What else do we got? Vitamin D. Vitamin D, come on, it supports your immune system. But that vitamin D has to be paired with vitamin K for proper absorption, has to be taken with food. So you want vitamin D in the mix. You want a good vitamin D supplement. Vitamin D fixer. We have 10,000 IUs of vitamin D paired with K. And I firmly believe that 10,000 IUs of vitamin D daily, that should be your maintenance dose. Anything less than that, you're probably going to drop below that 80 to 100 optimal range for vitamin D. Vitamin D, we want you 80 to 100, depending, of course, on what country you're in. So we want to make sure that you are getting enough vitamin D and absorbing it. That also improves your immune system. Okay, also in that list, the controversial iodine. Here we are with that topic. Iodine. Okay, so for iodine, I get it. Oh yeah, we address men with Hashimoto's. Yeah, absolutely, in the book. We don't leave you guys out. Okay, iodine. I want to say about 40%, maybe 30% of influencers or health influencers out there say to avoid iodine. 60 to 70% are on the pro iodine. I am pro iodine. Iodine is needed by your body. It's needed by your thyroid gland to produce T4 and T3. It's needed by your thyroid gland to convert T4 to T3. It is required by your breast to help protect you against cancer. It is antiviral, so it really helps with your immune system. And it is one of the main reasons why you have an elevated reverse T3, and that is low iodine. Now, I studied iodine for about 3 years before I brought it into the Fixer line, because I really wanted to know what the best type was. So we have a couple different types of iodine out there. We have the Lugol's formula iodine. Lugol's is basically the OG iodine. It's potassium iodine iodide. And it's okay, but you know what I find with Lugol's, number one, it has been shown to have heavy metals in it. So that's a problem for me, and that's a problem for thyroid patients. We don't want heavy metals in the mix. Number two, it can easily, with one extra drop, push you hyper or hypo. Now, years and years and years ago, I started Lugol's and I went one drop too many, and I actually went hypo. So I started gaining weight. That was not fun, especially after I was already, optimized, and I started playing around with iodine. And then I dropped into a hypothyroid state. That's not fun. So what we actually use is nascent iodine. It's a monoatomic iodine, nascent iodine. That is what is in Iodine Fixer. That is more bioavailable. It's better absorbed by the body, and you don't get that crazy shift where all of a sudden you go one drop too many and you feel like, oh my gosh, I'm hyper. I drank too many Red Bulls. And you don't go hypo where you're gaining weight and losing your hair. So nascent iodine, I like going anywhere between 6 and 25 milligrams a day. 6 and 25 milligrams a day. Don't tell me, oh, but the RDA. We know that recommended daily allowance is by our 3-letter alphabet soup government. So it means nothing in the world of health and nutrition. So you definitely want iodine. The other thing I'm going to put into the no doc category is black cumin seed oil. So this is what I was talking about earlier. We have Hashimoto's Fixer. So this has 3%. Here you go. 3% thymoquinone in it. So there's black cumin seed oil, 3% thymoquinone. Do not go on Amazon and say, well, I found one for 50% thymoquinone, because that's not even a thing. It's fake. Like, if you find anything other than 3% thymoquinone, it's fake. You want 3%, but you don't want less than 3%. That's the active ingredient. That is what is going to put your antibodies down. But the other thing that Hashimoto's Fixer does is it actually lowers inflammation. Lowers inflammation in the body. This is one of the only supplements. Black cumin seed is one of the only supplements where we can say it actually helps prevent cancer, because there are studies behind it. There are multiple studies behind black cumin seed oil that shows that it literally helps prevent cancer, lowers your risk of cancer, helps with hair loss, helps with inflammation, helps with weight loss. So I personally put this as a no-duh supplement. I take mine every day, obviously, with my history of cancer, but who doesn't want lower inflammation, lower pain, better insulin sensitivity? I mean, my goodness, come on. And when we lower our antibodies, we're stopping that destruction. Remember, we talked about earlier when we were doing the lab reads, you have those soldiers, and those soldiers go out and they beat up your thyroid over and over and over again. Don't want that. We want to lower those soldiers, push them into remission, lower those antibodies, right? Okay, so there's also zinc. Cameron, I see your question. So what is the number one supplement to promote thyroid conversion? So you already got the D, you got the C, you got zinc. That's beautiful. That is also in T3 conversion fixer. Thank you for mentioning that. And selenium. Probiotics you don't have to take every day. And you have magnesium in there. The other thing that we find that really, really helps with T4 to T3 conversion is T2. So that is what is in the other two that are behind me. We got Thyroid Fixer and Metabolism Fixer. When I created the Fixer supplement line, we got this. Okay, this. There we go. When I created the Fixer supplement line, I started with T2 because I had done 15 years of research on it. And I started using T2 with my patients, and I was seeing these major changes. So these patients, and I'm going to rewind many, many years before we had the Advanced Thyroid and Hormone Clinic, where we now prescribe to all 50 states. So anyone listening to the sound of my voice, if you are absolutely stuck with your doctor and you're listening to all this and you know you need different therapy and you know you need bioidentical hormones and you know you need a change of thyroid medication, and maybe you want a GLP-1 in a microdose form, because like Karen and I just talked about, it absolutely does help with your receptor sites, with your utilization of thyroid hormone. When it's done properly, we can use a lower amount of thyroid hormone when you're on a microdose. If you need any of that, we do that at the Advanced Thyroid Hormone Clinic, all 50 states in the United States. Sorry, Canadians. I know. Man, you guys are in a tough country up there. You just are. My heart goes out to you. So we're there for you. We're absolutely there for you. You can book a call at any time, at any time. But here's the secret with Thyroid Fixer, Metabolism Fixer, T2. So I was using these back before we could prescribe to all 50 states, because there was a time that we couldn't. And I was sitting across from these women, just seeing their pain. Just seeing their pain. They were on T4 only. We already said T4 only doesn't work. You will never, ever, ever, ever get optimized if all you're taking is Synthroid or Levo or Tirosint. It's not going to happen. So these poor women, they're on T4 only. They're coming to me for help. Obviously, we're doing all the things. I started adding in T2, and they're losing weight, and they're seeing these shifts despite being on crappy T4 only. Their body was changing. Their body was shifting. Their energy was coming back. This was incredible. But at the time, it was in a bro science formula. And the bottle had a gorilla on it with like claw marks. So I'm kidding. I'm not kidding. I'm not even kidding. So when it came time to start Fixer formulas, that of course was going to be the flagship product. I'm like, I got to get this out into the world. It has to be in a normal bottle, no gorillas, no claw marks. This is it. Oh wait, this one, Thyroid Fixer. So Thyroid Fixer was first. Then we got questions like you're probably asking right now, can I take Thyroid Fixer if I don't know if I have a thyroid problem? The answer is yes. But we also then created Metabolism Fixer, because isn't that so much clearer? It's going to fix your metabolism. So T2 helps with T4 to T3 conversion, but it also helps increase your resting metabolic rate. So literally the amount of fat that you are burning just sitting here goes up. You burn more fat at rest when you add in T2. So we started adding that in as well, and that absolutely helps with conversion. Absolutely helps with conversion. Okay, Bea, you take about 30 supplements and herbs a day. That's a lot. But you got, you're addressing multiple health issues, thyroid, osteoporosis, osteoarthritis, lymphedema, and you're taking them without the supervision of doctor or coaches. You don't know how to deal with this. Oh, girl. Well, no, I would say, a lot of people are in your position. This is what I see all the time. People on massive amounts of supplements, they're not quite sure why they're taking it. This is where working with a team like ours will absolutely help. Allison just jumped in. Dr. Amie helped me. I took her program. What a difference I feel. She knows. Oh, thanks, girl. I appreciate you putting that in there. I appreciate it. So yeah, Bea, it's just a matter of working with someone that can sit down and literally comb through your supplements and just, help guide you in what you absolutely need. Elizabeth, you're saying about L-tyrosine. L-tyrosine is actually in Thyroid Fixer. I'm glad you brought that up. It does help the thyroid gland to actually produce more T4 and T3. So love L-tyrosine as well as an amino acid. Ashwagandha, Beth, yes, you can take ashwagandha if you have Hashimoto's. We have that in the T3 conversion fixer because it does help with conversion. So yes, you absolutely can take that as well. Let's see. How do you order supplements from the UK? We absolutely can order supplements from the UK, or you can order our supplements from the UK and we ship them over to you. So you can check that out for sure. Let's see. What? Oh, selenium, Melody, selenium, selenomethionine, it's an S. So if you go to the website at Better Life Doctor and you look on T3 conversion fixer, you'll see the spelling of selenomethionine on there. Okay, let's see. What if you, Tammy, what if you were taking a multivitamin that has magnesium, that has dimagnesium 250? Do you still recommend taking 300 milligrams of mag bisglycinate before bed? So first of all, Tammy, this is a great question because most multivitamins, just in general, they're not going to have the amount of anything that you actually need daily. Their multis are really nice just for, oh gosh, like let's say someone has celiac disease, and you just kind of need that blanket coverage because they're not really absorbing enough from their food, breaking it down in their stomach. That's a whole other topic I'll get to about low stomach acid with Hashimoto's. That just popped into my mind. But let's say, you want to throw in general multi, or we know that when a woman is pregnant, we need that prenatal multivitamin. But in general, you're not going to get the proper amount of magnesium, the proper amount of vitamin D. You're not going to get that from a multivitamin. You need to take the individual supplements to really get the level that you need. Now, dimagnesium, I'm not quite sure what that is exactly. I'm going to assume that it's 2 different mags. Quad Mag has 4. That's my preference, because then you have everything. You have everything covered. Let's see. Nicole, you're saying been taking T2 thyroid fixer, started on HRT, although balance those. My thyroid numbers got much better since starting thyroid fixer. Thank you. You are welcome as well. You are absolutely welcome. Let's see. Copper fixer. You're asking about copper. Copper is very, very interesting. Copper unlocks ferritin stores. So with ferritin levels, and I saw a couple of these pop up when we were doing the lab reads, with ferritin levels, we want that ferritin 80 to 100, sometimes even over 100, especially when we're dealing with Hashimoto's. But if we're at like 300, 400, 500, your iron stores start building up. We want to add in copper to unlock that ferritin and release it into the body so it can be utilized. That's a very simplified explanation. Don't hold me to that. Very simplified explanation. Let's see. Do any kind of supplement questions? Beth is going to get Hashimoto's fixer. That's amazing. How old is your book? Okay, so we're over here. Okay, not a lot of supplement questions here. I'm coming over here. What's that?
Yeah, keep going.
Good. Okay. Should you take iodine if you don't have a thyroid? Yes, Cameron, because it's needed by every single cell in your body. Every single cell in your body needs iodine. And it's very, very protective against your breast. It's beautiful for your immune system. I take extra when I travel. And what I'll do is I'll put a little dropper of, I'll put a few drops of iodine with saline water in nose spray. And I'll squirt that in my nose while I'm flying. And then that, I feel, puts another layer of protection. Another layer of protection. Okay, let's see. My God, that's what happened to me when you took, okay. Yeah, that's what happened to you when you took Lugol's. You got anxious, jittery, and palpitations. Exactly. And that is why I like nascent iodine and iodine fixer. Absolutely. So total thyroid patients, yes. Iodine and black cumin seed oil. My goodness, why not? And that's, whenever we're talking about it, this just makes me pause here. Whenever we're talking about not having a portion of our body, like not having our thyroid, not having our uterus. I saw a question earlier when Karen was talking, can I take progesterone without a uterus? Well, yes, because hormones do more than one thing in our body, right? And supplements do more than one thing in our body. Like magnesium isn't just there to help us poop. It helps T4 to T3 conversion. It helps with sleep. It helps calm our brain. It helps relax our muscles. So same thing, progesterone, you still need it for your breasts and your bones. I don't care whether or not you have a uterus. I don't care whether or not you have a thyroid. You still need iodine for every single cell in your body. Black cumin seed lowers inflammation and helps protect against cancer. It's not just about your thyroid. And you can have, by the way, Hashimoto support by the fixer with black cumin seed oil is for any autoimmune conditions. Yeah, of course we named it Hashimoto's because I'm the thyroid fixer and this is a targeted thyroid line. And a lot of people have Hashimoto's, but basically if you have any autoimmune condition, you can take Hashimoto support by the fixer. It's going to lower your antibodies. So add it in. It also helps prevent against cancer. Add it in. Absolutely. Zan, the iodine supplement was iodine fixer as part of my fixer supplement line. Oh, Diana, no, we don't use any sugar in our supplements. Are you kidding me? Are you kidding me? I don't even know people that do use sugar well, I guess in certain protein powders, you could find that, right? But no, even in metabolism fixer, this is a powder. It tastes amazing in water. I put it in my water all day long. It's amazing. We use something called Ono Sweet, which is a fermented stevia, which means even people that are like, I can't do stevia, I tend to bloat. In the fermented form, you can. It's not going to make you bloat. And yeah, you're not going to get, some people will get like a little bit of a blood sugar spike from stevia. Not many, but some people do. But when it's fermented, you don't get that blood sugar spike either. Is there T2 and NT thyroid? Yes, there is, but it's very, very tiny. So when we're looking at the studies on T2 of how it's It increases your baseline metabolic rate, decreases inflammation, browns white adipose tissue, helps with fatty liver disease, helps with cholesterol, helps with insulin and insulin sensitivity. When we're looking at the studies of T2, they're using 150 to 300 micrograms in that study. Specifically, if we hone in on those human studies where we showed an average of a 9-pound weight loss in a month, an average of a 4% reduction in body fat in 28 days, those human studies were using 150 to 300 micrograms of T2. So that's what we put. One serving of Thyroid Fixer or Metabolism Fixer has 150 micrograms. So you can go up to 300 micrograms safely. NT thyroid, you might get 6, 9. Like it depends on the dose that you're on, but you're only getting a small, teeny tiny amount. This is really why I call it the forgotten thyroid hormone, because it is produced by your thyroid gland, but we don't pay enough attention to it and its importance, but it is kind of coming up in the research now, especially since I've been talking about it left and right and have it in my book. It's important. T2 is very, very, very important. Thanks, Dina. I'm glad you like my iodine supplement. Thank you. No, some people will absolutely, like when we start on, oh, Jamie, thank you for saying love Thyroid Fixer. When we start people on iodine, so like even when we're starting patients on iodine, because when you start to optimize your thyroid, you really got to give it about 3 months to really change. Like even when you're adding in bioidentical hormones, it takes about 3 months to really move the needle, shift your body, start changing things in your body. So when you start doing that, you got to give it time. When we start people on iodine, when we start patients on iodine, it's like, they're like, oh my gosh, my brain's lighting up. I feel amazing. What? The lights are turning on for the first time. I feel great. It is amazing what it can do right away. Here's the other thing I totally forgot to say about iodine, and this is imperative. This is imperative. And this is one of, I would say this reason, based in science, is the number one reason why I am so confused about practitioners that say to avoid iodine. It literally makes no sense, and it's not going to make sense for you either once you hear this. Once you hear this, you can't unhear it. So listen. The receptor sites on our cells, you know, all of our cells have a little receptor site for T3, but they also all have a little receptor site for iodine. And we're gonna roll back to 7th grade chemistry, maybe 8th grade chemistry. Remember the periodic table of elements? And on that periodic table of elements, we see bromine or bromide, fluoride, fluorine. This is in the halide halogen category. Chloride or chlorine, iodine or iodide. So they are all considered halogen or halides, depending on whether it's an IDE or an INE at the end. That receptor site on your cell can take up any of them. Yep, you can have fluoride dock there. You can have the chlorine that's in your water system dock there. You can have the bromide that's on your clothes, on your furniture, and your rugs, on your carpet, on your grass. You can have that dock there. And those are toxic. Those are toxic halogens, toxic halides that will wreak havoc with your thyroid and do massive amounts of destruction. Worst case scenario, they're going to cause cancer. The only way to kick off those toxic halogens from your cell receptor site is having enough iodine. Now, if that doesn't convince you to add in iodine, I don't know what will. Honestly, I don't know what will. And that is why I don't understand practitioners that say to avoid iodine. I just don't get it. Okay, can you take Thyroid Fixer and Metabolism Fixer together, and or should we start with just one? How do we know where to start? Angela, yes, you can take them together. Just take one serving of each. So you've been seeing some pictures that we've been posting online. We did a fixer transformation. We took these groups of ladies. It's so cool. You're going to be seeing so much more from them coming up. We took these groups of ladies. We did not treat them as patients. Many of them had hypothyroidism. Many of them were on T4 only. Many of them had low hormone function, and there was nothing we could do because we weren't treating them as patients. We didn't bring them into the clinic and give them hormones and thyroid medication. All we did is give them thyroid fixer and metabolism fixer. That's all they did for 16 weeks. And again, proof positive, showing me what I saw in clinic years and years and years ago when I was studying T2 and using it on these women that were on T4 only. All of them lost weight. They all lost weight. I mean, anywhere between like 9 and 50 pounds, they all lost weight. One was a cancer survivor, but she was actually still going through treatment. She was on prednisone and she still lost weight. She still lost weight. So yes, we paired up thyroid fixer and metabolism fixer together, and we did 1 serving each with these ladies. And that's what they took for those 16 weeks, and noticed a tremendous, tremendous difference. Okay, Hashimoto's fixer is black cumin seed oil, Tess, and then thyroid fixer is the T2. Okay, let's see what else we got going on. Sharon, yeah, we can't take Canadian patients anymore because your country's become a pain in my butt. It's just literally impossible to get the labs up there. It's like you have to get your own labs, and it's damn near impossible to get a reverse T3 up there. And we absolutely need that. Now, something might happen, and as soon as it does, we will obviously announce it. Things are changing all the time. Something might happen that we figure out a way to get you the medication you need up there, get you the lab requisition you need up there. But for now, just how about you move down here? How about that? Right? Right. Yes, Brent, we can shift to Canada. Absolutely. We can shift to Canada. Ingrid, thank you. She said, I love metabolism fixer. Jules, I'm using Nutrafol to help with hair loss. How are those supplements in your thoughts? I also take other supplements and not sure what to add to help with Hashimoto's and hypothyroidism. You know, Nutrafol, I can't say that we've had a lot of people have great success with that, you know, because it still isn't addressing the root cause. When we're looking at hair loss, we need to find out what is causing it, or even hair thinning, hair breaking, hair loss. Is it autoimmune? Do you have Hashimoto's and you need to, maybe you need to, Rhonda, maybe you I'm sorry, wait, who is that? Jules, maybe you need to add in Hashimoto's fixer to calm down the immune response, calm down that autoimmune response, because remember, autoimmunity can also attack the follicle. So even if you have Hashimoto's, that can very easily shift into alopecia areata, which is the autoimmune form of basically hair destruction, your immune system attacking your hair follicle. So if that happens, you're going to lose hair, or you're going to not get the nutrients to your hair shaft that you need. You need to find out the root cause. Is it estrogen? Is it testosterone? Is it low ferritin? Is it your thyroid? Are you insulin resistant, and that high insulin is causing inflammation? Do you just have high inflammation, high systemic inflammation? So we need to find that root cause. And then, then you can kind of get a better idea of whether that Nutrafol is working or not working. You know what I mean? Like, I think it's just a Band-Aid at that point. As you want to be here. What is after the supplement talk? That's the big one. That's the big one. We are going so deep into thyroid and hormones and the testing and why your stuff isn't working and what you need to do. And then we're doing our big grand prize giveaway after that. So you want to stay on, you want to stay on, and you definitely want to be here, be back here in your seats. If you have to go to the bathroom now, be back here in your seats in 20 minutes. But we're going to keep going. How does low ferritin play into thyroid health? And do you recommend a way to raise ferritin, Dina? Yes. So low ferritin does play a role in thyroid function. Your T4 to T3 conversion depends on adequate levels of ferritin, as does your ability to tolerate T3. Sometimes people with low ferritin levels, they're not able to tolerate that increase in T3. And that's a hurdle when we start actually trying to get them optimized. So I do have Iron Fixer in my line specifically for all the patients that we saw with low ferritin levels. I mean, it's an issue. It's a real issue. If my free T3 is low, should I do conversion fixer or supplement with T2? iPhone 87, I would do T2 because you might actually get a little tiny bump in your T3 with T2 added in. Corey, B vitamins. I'm so sorry. Did I not mention that? Yes, I love you. Thank you. B vitamins, absolutely important as well. So your whole slew. So we have B fixer. You want the B12, you want the B6, you want the B2, you want all the B vitamins. You want a really, really sweet B complex. And I made B fixer in a liquid form because we all get sick of pills after a while, and anything that we can take in liquid form that is absorbed, by the way, and isn't super low dose, like vitamin D in liquid form is always 2000 I use, and that's never enough. When it's actually in a liquid form that is absorbable and gives you everything that you need, then we put it in liquid form. So that's what B fixer is. Zan, can you help diabetic men on high dose levothyroxine and blood pressure? Oh, Zan, yes, yes. I love you. Okay, first of all, you're on levo, which is T4 only. That's not going to work. You probably have high blood pressure and diabetes because your thyroid isn't working properly. We need to address your thyroid, get you off of that levo T4 only. We need to bring in T3, whatever that looks like for you. And then we need to check your testosterone because I guarantee you, if you have hypothyroidism, your testosterone is being impacted as well. I have a special place in my heart for men with hypothyroidism and Hashimoto's because they always get put on these Band-Aid medications, and it's just a shame. So yeah, you're on high blood pressure medication and you're probably on something for your diabetes and it just isn't working. Let me tell you another story too. So we have this patient, and I talk about her in the book when I'm specifically talking about, are you wasting money on your GLPs? Are you literally burning hundreds or thousands of dollars a month? We had a patient, full-blown type 2 diabetic, came into the clinic. Her A1C was an 11.9. 11.9. That is full-blown type 2 diabetes, by the way. 11.9. She was on a prescribed GLP-1. Been taking it for a year and a half. Prescribed GLP-1 for a year and a half. It wasn't working. It was not working. She might as well just burnt that money. It wasn't working at all. Prescribed GLP-1. Well, she was also on levo, like you, Zan. Levothyroxine, reverse T3 was elevated. Her thyroid wasn't optimized. We optimize her thyroid. We bring the reverse down. We bring that free T3 up the right way. We also put her on hormones because nobody was putting her on hormones. And here's this poor woman in her late 50s, early 60s, never on hormones. So we give her the bioidentical hormone replacement therapy she needs. We give her the thyroid treatment that she needs. We lower that reverse T3. We increase the free T3. Guess what her A1C does? Comes down to a 5.4. She reversed her diabetes. Now the GLP-1 is working because we fixed her thyroid first, because the thyroid is the master gland. The thyroid controls your blood pressure. The thyroid controls your insulin and your glucose. Your thyroid dictates whether or not you are going to be walking around with diabetes or whether you are optimal. Your thyroid dictates whether or not you're wasting money on that GLP-1. So if you're on a GLP-1 right now, and there's a lot of people listening, if you're on a GLP-1 and it is not working, for goodness sake, check your thyroid. Check your thyroid and optimize your thyroid no matter what you have to do. Stop wasting money. You're burning your money. Stop. You need to address your thyroid and your hormones first, and then we can add in the GLP-1. Or we can add in the GLP-1 in a microdose, but we're not going to have you blowing through macro doses when it's not going to work anyways. It's just going to cause gastroparesis and stop you from pooping. We're not going to do that. We're going to use it in the right way, but you're going to get the bang for your buck because you're actually optimizing your thyroid at the same time. Everything works together. So let me see if that resonated. Anybody? Oh yeah, Dana. Yep. Okay. Beautiful. Yeah, a lot of people have wasted money on a GLP-1. I get it. I'm seeing you in here. My husband is struggling to lose weight. He's pre-diabetic, has high blood pressure. He's going to test his testosterone. Should I have him test his thyroid levels as well? Yes, Jennifer, absolutely. You are quite welcome, Zan. Quite welcome. You have to test, not guess. Absolutely right, Dana. You have to. And it's all in the book, what you need to test, what you need, where you need to be from an optimal standpoint. You absolutely want to do that. You want to test, not guess. Kendra says, are there any supplements that we should avoid with Hashimoto's, specifically immune stimulating supplements? Kendra, I'm not even sure. Like, Immune stimulating. I mean, vitamin D supports your immune system. I'm trying to think what else, if you want to type it in the chat, what else, what other supplements are you kind of thinking that would be immune stimulating? There's nothing necessarily that I would say to avoid with Hashimoto's. It really becomes more, we'll say, individualized to you. As to what you actually need. There's nothing coming to mind of what you need to avoid. Okay. Elderberry. Nope. Haven't heard that as immune stimulating, like medicinal mushrooms. Nope. You're good there. Medicinal mushrooms modulate the immune system. Yeah. But any kind of modulator of the immune system is going to modulate it in that it's going to adjust it to like an adaptogen almost. So you're not going to all of a sudden stimulate autoimmunity. That's not going to happen. So you don't have to worry about that. Yeah. Peptides besides GLPs, Dina. So I actually like thymosin alpha 1, especially if you do have Hashimoto's, because again, thymosin alpha 1, and this kind of ties into the immune stimulating, immune modulating. It modulates the immune system. But when we support our immune system, we're actually supporting autoimmunity. So we're not stimulating our soldiers to go out and attack. We're actually helping to reprogram them so that they don't think that the thyroid is a bad guy or that other body parts are a bad guy. So we want to support our immune system and not have it tank. I actually take thymosin alpha at least 3 to 4 times a week, because I'm trying to support my immune system. Since I had cancer, I want to support my immune system. So those surveillance systems that I talked about earlier, how we all have cancer cells, the surveillance system is out and it's working and it's targeting those cancerous cells that want to turn. Okay. Vitamin C, always good. Marquita, you want to liposomal form? Yeah, that's totally fine. That's totally fine. Thyrogen, Mary Lou, I was all psyched about it when it first came out. I had a podcast on Thyrogen, that's a bioregulator for anyone listening. And then I haven't really seen it work like we thought it was going to. I would say if you have, you remember the podcast. I would say if you have hyperthyroidism, that's not bad to add in a bioregulator, because it's regulating your thyroid. It really, the bioregulators help with hyperthyroidism and like kind of calm down that autoimmune cascade. But I'm not really finding that it helps with thyroid function outside of the treatment. Like you can't just do a bioregulator and not actually work on your thyroid numbers, if that makes sense. Yeah. Okay, let's see. Nana's iPad previously said her ferritin is optimal at 80 to 100. Okay. Yeah, 80 to 100. LDN. So low-dose naltrexone is, we'll stack that on. So after we start with Hashimoto's fixer, black cumin seed, we will add on LDN if a person can tolerate it. Low-dose naltrexone is sometimes not tolerated. Sometimes you can have really high cortisol levels from it and get that cortisol spike. Some people will feel this flat affect, like it takes away your kind of what like high dose GLPs are doing, right? They're taking away that dopamine. They're creating this dull, flat affect where people, like, they're not depressed, they're not happy, they don't really want to do anything. This is why Vegas is suffering, I guess, because nobody wants to go gamble. It creates this flat affect. So LDN is not great for everyone. Supplement for high ferritin would be, well, actually, Nana, your high ferritin is not really all that high at 163. I wouldn't touch it. Jennifer, if you had to pick between thyroid fixer and Hashi fixer, it all depends on what your goal is. If you have weight to lose, if you're struggling with a metabolism, I would add in thyroid fixer for sure. How do we regulate cortisol? Well, it depends whether it's high or low. You got to test your cortisol the right way with a 4-point saliva cortisol panel. And then you want to see where it's high and where it's low. Sometimes T3 can help with cortisol by actually bumping up low cortisol levels. Sometimes an adrenal glandular will help. We have an adrenal glandular in the line, but that helps with cortisol as well. Best range for ferritin, Melody, is between 80 and 100. EDN100. Okay. So right now I'm going to come back. We're going to keep going. I need a 2-second bio break. So 2-minute bio break. I've been with you for a while. I'm going to run. You guys take a bio break as well. You want to be back here in 10 minutes. You don't want to miss it. Like, this is where stuff really starts getting fun, So I will see you back here. I do have a lot of energy, Dina, because I love doing this. I absolutely love doing this. No, I will be back here in 2 minutes, literally 2 minutes. Go fill up some water, go do a bio break, and we'll see you guys back 2 minutes. We're going to keep going with the questions, and then we're going to have a lot of fun. I'll be back.
You'll be back.
I'll be back. Back. Oh, I think we actually got more people during the bio break, so that's fantastic. I absolutely love it. Absolutely love it. All right, let me get here. Here we go. Okay, let's keep rolling. Thank you for your patience, and I love the fact that you guys are still on here. Miss Paula, I'm going to answer your question here. Hypothyroid here, hair loss, inflammation, post-lumpectomy, 0-stage breast cancer, no radiation or chemo, but being told to take hormone blockers. Don't want to do that because of side effects. Paula, I have a very special place in my heart for you. If you've been following me, you will know that last summer, so I was diagnosed with uterine cancer, had to have a hysterectomy, tried to do all the things before actually having that hysterectomy. But I got to tell you, Paula, the one thing that I did is make sure that hormones were on board. And about 10 minutes, we're going to be diving into hormones too. Want to make sure hormones were on board, that I had that protection. Hormones really do protect. They do amazing, amazing things in our body. And I was mentioning it earlier. I have a couple of podcasts on the Thyroid Fixer podcast where I interview experts. Actually, we just did a mashup. It was a couple of months ago, but I took the best of Dr. Lindsay Berkson, Dr. Julie Taguchi, Dr. Jen Simmons interviews, put them all together in one where we go deep with hormones and cancer and their actual safety profile, and hormones protect you against cancer. So Paula, make sure you check that out. Okay. Zoom user, I don't want you to leave now. You have to go to graduation. Bah! Okay, well, you got the book on audio. Make sure that you just keep following me because you're going to miss the best part. So you're going to have to jump in another time. You're going to jump in another time. Oh, Rebecca, I have too many questions to ask questions. You're so funny. Just pop them down below. We'll get to them. We'll get to them. Okay. Yes. Truck in crochet. I freaking love that. Yes, we are accepting new patients. So we've been popping the links in the chat. If you do want to book a call, you absolutely can do that. We can walk through what it looks like to work together. Mary Lou, LDN, going back to that, we were talking about before the bio break. LDN can cause problems with losing weight because if it spikes your cortisol, then yeah, you're going to notice a little bit of weight gain. Yeah, you can notice some weight gain there. Okay, truck and crochet. We got the link down below. Become a patient. We got that down below. Okay, let's see here. Karen, my TSH went from 1.2 to 1.9, then jumped to a 4 before going down to a 3.5. But my doctor says there's not a problem, as the thyroid does this. But I put on 20 kilograms in 18 months and have all other symptoms apart from not being cold. I sweat and said, yeah, Karen, heat intolerance can be a thing as well. Like I am heat intolerant. I cannot stand the heat whatsoever. So I'm just like you. Yeah, Karen, just like we talked about before, and just like we're going to talk about, so yeah, you're in the right place. You know, you can't just go by the TSH alone. And when you have those symptoms, that is a gift given to you by your body. You know, I always say symptoms are their presence given to us by our body, just to say, you know, hey, there's something going on here. You might want to look deeper. And if we ignore those symptoms, what's going to happen is our body's going to start screaming. You know, our body gets really pissed off when we ignore it. So the symptoms will get worse. The weight will keep going up. The energy will keep going down. The brain fog will increase. You'll end up on an antidepressant. Like, you don't want that. We don't want that at all. So you have to listen to those symptoms. And if you have all of those symptoms, regardless of your TSH, you're gaining weight like crazy. So you need to do something about it. Terry, you just start with the complete thyroid hormone panel. Okay. So you have a male friend. What is that? 370 pounds, 6 feet tall. He has nice hair, but low energy, wants to sleep during the day and has brain fog. Yeah, I would look at the complete thyroid hormone panel. Absolutely. I would do a full thyroid hormone check on him because yeah, you're going to learn next year. That's really something that goes together and something you absolutely need. So iPad 4, you don't purchase bioidentical hormones. Those are prescribed. Bioidentical hormones are prescribed. So the ones that Karen was talking about earlier, the estriol, the progesterone, anytime it's in a cream form, you know, it has to be sold as a beauty or skincare product. It's only topical. We can't do injectable testosterone or oral progesterone or an estradiol patch. And we can't do it we can't go over the counter. You can't put something in an over-the-counter cream that's equivalent to a hormone, like what we would prescribe for you. So bioidentical hormones need to be prescribed. Okay, Dina, you're awesome. Thank you for being in here. So Island? Yeah, I think EILAND. My iodine is high. Do I still need iodine? Your iodine is probably high because you're taking iodine. And here's the thing. Testing iodine is so hard because there are so many different opinions out there as the proper way to test. I can tell you for sure that dropping iodine on your arm is not the proper way to test it and looking at how it absorbs. Then there's a provocation test. There's blood. There's all kinds of ways to test iodine. Every single cell in your body needs iodine. Why not just take it? That's where I'm at with it. Every single cell in your body needs iodine. So just take it. Just take it. Can your capsules be open and mixed in a liquid? Absolutely. You can totally do that. You can totally do that. Let's see. Okay, we got that. EBV and Hashimoto's, they absolutely do go together. We all have Epstein-Barr virus. We do. We all have EBV. So it's just a precursor. It's just one of those things. It's just a precursor. Let's see here. Functional doc is letting me experiment with 5 micrograms of Cytomel twice a day. Well, and it's not helping. Free T3 is a 2.6 and reverse is a 25. Whoa, Robbie. So that is a messed up thyroid. Again, I don't know if you were here earlier, but we were literally saying earlier that when a functional doctor or integrative doctor doesn't test reverse T3, but also, I mean, for yours, like they tested a reverse T3, but it's screaming at us. It's like punching us in the face. Your free T3 is low and your reverse T3 is high. So you actually need, I would love to know what your testosterone is. Yeah. But you need to address your thyroid. If you stay on 5 micrograms of T3 twice a day, that's not going to do it. That's not going to be enough. That's not going to be enough. It's going to be that baby dose that does more harm than good. And we certainly don't want that for you. So no, you absolutely need both thyroid and hormones in the proper amounts for you to get you optimized, just to get you optimized. All right. So we are going to be diving into now and having just so much fun. So much fun. So much fun. Here we go. Let me bring up my screen. Close the chat over here. We'll bring it up in a minute. Okay, that was my Zoom. Then we're going to share. All right. Bam. Now we're going into the fun part. We are going to learn how to fix your thyroid and your hormones together live. Oh, you guys are going to have fun over there on YouTube as well. I'll be checking the chat. Let me bring up the chat because I want to see you all in here. Okay. I love you, Ingrid. Refill your glass of metabolism fixer, everyone. Here we go. So, I mean, so many of you have joined me today. I just got to say, I absolutely love you. I absolutely love you for being here. For those of you on YouTube, hang in there. I'm going to be checking the chat as well. I would just love to know, like, where are you guys coming in from? Like, I know we have some Canadian people in here, but we're going to be really having some fun, if you're living in the UK. Oh, Erie, Mary, how about that? Hello, that's my hometown. All right. Oh gosh, Iowa. I saw in Iowa. I'm getting lots of Canadas here. Ohio. So we got South Africa. We have people coming in from everywhere. I should have asked this 2 hours ago. Just trying to see like, oh, we got South Carolina over there. Oh my gosh, this is crazy. Like we're like hitting all over the world. All over Pittsburgh. That's my old stomping grounds as well. I was there for 18 years. Absolutely amazing. Oh, I love you guys. Thank you for coming in from literally everywhere. So, you know what? I just want to say what we are going to do today in the next hour and a half is going to be exactly what you need. You're going to find out what's happening inside of your body and literally exactly what to do about it. So before we dive in, I just want to be completely and totally transparent with you because I totally respect your time. This is not going to be just your typical health webinar. So I know you guys have been locked in for a couple hours with me. So I love that. I love that. So we are going to be diving into this for about an hour. We're opening it up for questions after that. So make sure you stay on. And then after that, we are announcing the grand prize giveaways, over $10,000 in prizes. So make sure you stay on for the entire time. You will absolutely get your questions answered. And then at the end of this training, I'm going to be sharing a very unique opportunity to work with me more closely if you decide to, and if you want support putting all of what you learn into action. But please do hear me when I say this much. You do not need to sign up for anything. You do not need to buy anything to get massive value from this next hour. I'm hoping that you even receive massive value from the last couple hours of hanging out with me. And thank you again for hanging out. You know, I love this. I absolutely love this. But my goal is that by the end of this next hour, you will finally understand what is happening inside of your body, and possibly why nothing that you have tried has worked, and finally what it truly takes to fix your thyroid and fix your hormones the right way. Because honestly, most people have never had this explained to them correctly before. No one. It's over here.
Okay.
So before I teach you anything, I need to talk to you. I really want to know what's happening in your life right now. I just want you to think on this. I'm going to ask you a question later, but I want you to think on it, because it's not just weight and it's not just fatigue. It goes deeper than that. It just does. It goes deeper than that. I did not recognize the person in the mirror anymore. When my body was rapidly gaining weight and I was losing hair and I was so damn tired and every doctor dismissed me, I didn't recognize the woman I saw. And I know so many of you are in this place, and it pains me. It pains me to see you in the place where you literally don't even recognize yourself anymore. The clothes in your closet don't fit. I was there. I didn't even want to get dressed. Your face looks different. Remember, we talked earlier about that myxedema. Your face looks different. Your body feels like it's like a runaway train, like it belongs to somebody else. Maybe you stop taking photos, or you take the picture, off the fridge or off your phone, on the front of your phone, because you don't even want to see. You don't even want to see yourself. You can't stand to see who you used to be. You know who you used to be. Maybe you're snapping at your kids because you're so damn exhausted that you have nothing left. Maybe you're snapping at everybody in the house, and then you're just lying awake, feeling guilty, eating yourself alive with guilt. I said this before because this is me. You stop going out. You stop going out with people. You stop going out with your friends. You don't want to get dressed. You stop initiating with your partner because your libido is gone. Maybe you're waking up at 3 a.m. just drenched in sweat, or your mind's racing and you can't get back to sleep. So now your sleep is in the toilet. You're 15 years into a marriage wondering what happened to the woman or a man that you used to be. That's not a way to live. So I want you to look at this list. We're going to go over some symptoms. On the left side, we have a lot of thyroid symptoms. So we got weight gain, brain fog, constipation, muscle pain, cold all the time, bloated, fatigue, hair loss, dry skin, sugar cravings, loss of the outer corners of your eyebrows, anxiety, depression. And then on the other side, on the hormone side, we got the hot flashes. We got insomnia, mood swings, irregular cycles if you're in perimenopause, vaginal dryness, hair thinning, night sweats, low libido, anxiety again, weight loss resistance, joint pain, migraines, which can go on either side. Type in the chat right now, how many of these are you? I know I rattled off some numbers earlier, but we got some new people on. How many? Just give me a number. Just give me a number. How many of these? Just type the number. I just want to see 90%, 12, all. Oh my God. Oh, Karen, I have scoliosis as well. I know it kills your back. Too many. 10, 9, Juliet 12, Chuck and Crochet. Yeah, that's why you need us 10. Oh my gosh, so many. All 10. Well, I was going to say if you have 5 or more, but pretty much, oh my God, 21 of them, all of them. Oh my God, my heart hurts for you. If you have 3 or more, you're in the right place. So you're all basically in the right place. You have thyroid and hormone issues. You do. If you have 3 or more, symptoms don't lie. Symptoms do not lie. All of them. Oh my gosh, this is incredible. This is absolutely incredible. For anyone over there, we're getting some numbers. We're getting 7, or sounds like my symptoms. You got to see this over here. These poor people, they're just dying over here. They have so many symptoms. Okay. So you have those symptoms, right? And I know you guys are eating clean. I know you're working out. I know you're doing everything. You're doing all the things. The scale keeps going up instead of down. You're struggling with the symptoms that we just literally went over. So I need you to hear me right now. It is not your fault. Has anyone ever told you that it is not your fault? It's not your fault. Don't medically gaslight yourself and blame yourself. It's not your metabolism. It's not your fault. It's your thyroid being misdiagnosed and mistreated, and your hormones are being completely ignored. And those two things together are why nothing is working. So that is why we are going to go over, and I'm going to show you exactly why everything you've tried has failed and why this is finally going to work. Finally going to work. Okay, now, let's take a deep breath. We just thought of a lot of symptoms that are ruining our life, but I'm not going to leave you in that place. I want to show you something else right now, because I want to show you the woman that you have been trying to get back to, or the man that you have been trying to get back to, because that person that you miss is still in there. They've been in there the whole time. They are buried underneath exhaustion, brain fog, hormonal chaos, and just years, because I know the years of being told that you're normal. It's all normal. And when your thyroid and hormones finally start working with your body instead of against it, that person that you once knew comes back. I promise you, he or she comes back. So I want you to imagine, as hard as it might be right now, waking up and feeling like your body belongs to you again. Like clear, focused, not dragging through the day, not fighting your brain through brain fog before you even get up. Imagine actually looking in the mirror and seeing that person again, seeing her again, seeing him again, the woman, the man that you thought that you lost for good. And maybe actually looking in the mirror, not picking yourself apart, not pulling your clothes, not avoiding the reflection, not looking at how your face is aged and counting every wrinkle, not wondering where you went. Can you even imagine loving what you see in the mirror again? Can you imagine feeling good in your body, feeling attractive, feeling confident again? It freaking can happen. That's the message that I give over and over again, that it can happen. Can you imagine being in control, not gaining weight, looking sideways at a brownie, like I always say, being in control over your weight, present with your kids, instead of counting down the minutes until you can just lie down on the couch? Can you imagine being engaged with your husband, with your wife, instead of pulling away because you don't want to be touched? You don't feel like yourself anymore. You don't want to get naked. You don't want to be touched. Let's get real. Like, we do not want to get naked even in front of our spouse when we don't feel good about ourselves. Can you imagine looking at photos without immediately criticizing every part of your body that you don't like? Can you imagine saying yes to the vacation, to the wedding, going to the pool, or maybe being in front of a camera? Like, that is the woman and the man that we're bringing back tonight. We're bringing it back. Now, some of you know me, and some of you have never seen this picture. And those of you who don't know me, here's why I know it's possible, that everything I told you is possible. So I was a fitness competitor back in the day. I was on stage. I was eating perfect. I was training 6 days a week. And I started gaining weight fast. Nothing fit. I absolutely did not recognize the woman that you see in this picture. Yeah, I was smiling in it. My friend's next to me. We're having a party. That's the only time I smiled. All the other times I avoided the camera. It took me years. My friend reached out and she said, why have you never shown this picture before? I said, I just found it. I had it buried. I threw away all of my fat pictures, all of the pictures during that time where I was going to doctor and no one was telling me what was going on. So I did what you all did. I went to my doctor, and doctor number 1 said, it's all in your head. It's all in your head. Doctor number 2, eat less and exercise more. I went through 3, 4, 5. I heard you're normal. Everything is fine. I heard you're just getting older, and I was in my 20s. I got handed an antidepressant. 6 doctors. Not one of them could tell me what was actually wrong with me. Not one. And I often think, oh my gosh, what if I would have stopped and believed doctor number 4, 5, or 6? So I decided to test. I ran my labs. Then I worked with a functional practitioner that saved my life. And he looked at these labs and said, oh, look, there it is. You have hypothyroidism. My thyroid was being strangled, destroyed. My hormones were in the toilet. I wasn't normal. It wasn't just in my head. I was literally being misdiagnosed by 6 different doctors. No one was testing me the right way. So I had to fix my thyroid and fix my hormones to literally get my life back. Huge transition, huge change. This is 30 years difference. And I am still optimized today. So my mission from that point on was to always be there for every single person out there so they can be the badass human they are meant to be. So you can be the badass human that you are meant to be. My mission is to empower you to literally take control of your thyroid and your hormones, because you can't fix one without the other. And you deserve the best life ever. Now, I have spent 27 years helping women and men fix the exact thing that I was once told I was normal for. So for those of you who do not know me, because I know there's people on here that are just jumping on for the first time, and they're just listening to this woman called the Thyroid Fixer because they want to learn. And I love you for that. But just so you know, my experience, I've been doing this many years, 27 years. We have worked with hundreds, thousands, millions. We have the reach of millions now with the Thyroid Fixer podcast. And now, of course, we have the book, The Thyroid Fix, out, that is guiding people to literally reclaim their health. Here's the other reason why I know fixing your thyroid and hormones work, because of all those people that we've helped before. So you are going to meet Lisa. Wouldn't be surprised if she's on here. She is in the Facebook group. She is absolutely amazing, so knowledgeable. So many of you have encountered her. You've thanked her for her jumping in and helping you. But this is where Lisa started. Lisa wasn't always optimized. Lisa didn't always know everything she knows now about the thyroid. She was 145 pounds overweight. And these are her words. She had zero energy. Zero energy, brain fog so bad, she'd forget where she walked into a room for. Dry skin, brittle nails, constipation. She had all the symptoms, just like you put in the chat, all the symptoms. And her doctor told her, you're normal. How many of you can see yourself in Lisa right now? Maybe you're 100 pounds, maybe you're 50 pounds, maybe you're 145 pounds overweight. And the biggest thing is she felt invisible. She felt like she was disappearing. She said this is one of the rare pictures that she allowed herself to be caught in. Now, imagine being Lisa today. She is 145 pounds down. She's eating more food than she ever has eaten in her life. Those are her words, not mine, her words. More energy than she had in her 20s. She is symptom-free. And she did this using the Thyroid Fix method, the exact same method I'm about to teach you tonight. And if you're thinking, oh, could that be me? That can't be me. Yes, it can be you. Because Lisa no longer feels invisible and she shouts it from the rooftops now because she wants this for you just like I want it for you. So here's what we're going over tonight. Number one, why your normal labs are keeping you sick, why your medication is working against you, and why your body is storing fat instead of burning it. So that's the meat. That is the meat of tonight. So buckle in. This is the part that nobody else will tell you. Not on Instagram, not on YouTube, not other influencers. This is it. All right. So let's go into why normal labs are keeping you sick. Thyroid hormones. This is the one that keeps more people stuck than any other. All right, first of all, before I go any further, I want to see a me in the chat right now. If you've been told that your labs are normal, but you know your body, you know your body, you know when something is off. How many have been told their labs, oh my God, it's lighting up like crazy. Well, Deb, we know you. Yeah, definitely. Oh, Joy. Yes. Oh, Jeannie, got Aaron. It's going so fast. I can't even read all the names. Like everybody. Oh my God, we've all been there. Heather, Karen, Tammy. Yeah. Okay. Yes. I love you guys. Hang in there. I'm so sorry. Yes, I know. Okay. So here's the big one, right? All these docs just tell you your TSH is normal. You're fine. 50 million Americans can't be wrong, right? 50 million American prescriptions for Levo every year. 50 million. 50 million Americans get a prescription for levothyroxine every year, and they get tested for their TSH, and they get told it's normal. Nothing to see here. You're fine. We said this earlier. I'm going to say it again. TSH is a brain hormone. It is not a thyroid hormone. So TSH is a signal from your pituitary. Your pituitary in your brain talks to your hypothalamus, which then talks to your thyroid gland. And that TSH, thyroid stimulating hormone, is a hormone that stimulates the thyroid. And basically, when it's released by the brain, it tells the thyroid to make more thyroid hormone. But it actually tells us absolutely nothing about what's actually happening inside of your cells. So your TSH can look picture perfect on paper. It can even be optimal. It could even be less than 2, like we talked about, while every single cell in your body is starving for the right thyroid hormone. And this is exactly what's happening to most of you in this room, most of you on this Zoom. If TSH isn't the answer, well, then what is? What should they actually be testing? Now, we went over that, but we're going to go a little bit deeper into what you actually need to be testing and where you should actually be. Free T3. Okay. This is imperative. This is what they should be testing actually instead of TSH. I don't care if they throw out the TSH, as long as you get free T3 tested every single time you check your thyroid. Now, free T3 is the active thyroid hormone. So that is what is running your metabolism. This is what hormone your cells use. Remember, we talked about our cells having a little receptor site on it, a receptor site for thyroid hormone, specifically T3. We do not have receptor sites on our cells for T4. We do have receptor sites on our cells for T3. It's like a little lock and key. So that T3 is the key. It's a beautiful, perfect key that fits into the lock on your cell and turns it. And that's what's turning on your metabolism. That's what's turning on your energy, turning on your brain. So if we look at this patient's free T3 level, she got it tested and it's a 2.3. Now, it does fall into the normal range, the within normal limits, that standard lab value range that's on your labs. 2.3. Now, her doctor sees this and says, you're fine. You're fine. But optimal, where you actually feel human, is a 3.6 and up on this lab. This is a LabCorp lab, goes to 4.4, 3.6 and up. So a 2.3 means she's clinically hypothyroid. Every single cell in her body is starving. And her doctor that she saw before us signs off, sends her home. You're normal. You're within normal limits. Everything is fine. In fact, screenshot this slide right now, because the next time your doctor says everything looks normal, I want you to know exactly what to ask for. You're going to ask for free T3, and you're going to ask for the other tests that we talk about, not just TSH. And most women never even knew that these labs even existed until tonight. Most people don't even know that these labs existed until tonight. But here's the part that's going to make some of you really angry. Even when it is tested, even by a functional medicine practitioner, if it falls anywhere inside the lab range and that practitioner does not know what they're doing with the thyroid, they are not a thyroid expert, you are going to be told it's normal. It's normal. I see this every single week. Every week, a woman comes into the clinic, free T3, 2.3, 2.4, 2.5, 2.6, and her functional medicine doctor that she's paying says that it looks great. Now, it's one thing we almost expect it in the conventional system. We almost expect people to just get dismissed and medically gaslit. But when you're paying a functional or integrative doctor and you come in with a 2.3, a 2.6, a 3, and you're told that you're normal and everything was fine, you're wasting your money. This woman, she's not normal. She's barely alive at the cell level. So just because you're with a functional medicine practitioner doesn't mean that you're with someone who knows what they're doing with the thyroid. And that is a hard truth, but it is the truth. And I will always tell you what you need to hear, not necessarily what you want to hear, what your pocketbook wants to hear. Reverse T3. I explained this earlier, but we're going to go deeper. Good luck even getting this one tested. Again, even in functional medicine, what's the rule? If you don't have reverse T3 tested every single time, you are not with someone who knows what they're doing with the thyroid. That is first and foremost. Most doctors don't even know what it is. They will tell you that they're only going to test it in a clinical setting, meaning if you're fighting for your life in the ICU or the ER. So if your reverse T3, first of all, if you even get it tested, then if it comes back at 18, 20, 22, we saw 24s earlier in the chat, 27 actually flagged high and they were dismissed. Optimal reverse T3 is under a 12. 22 on this patient is the reason why every pound that you try to lose doesn't go off your body. That's why every pound that you're trying to avoid keeps coming on. This is a major, major reason why people lose weight and stay sick. You know, we saw a couple of people earlier giving examples of how they're on T4 only and their reverse T3 is high. The only hormone that pushes up reverse T3 is T4. And we're going to talk more about that as we go along. So bear with me. The next lab that really puts you in a bad position when they test it is when they test your estradiol and you're a woman and you're in menopause. They'll tell you it's totally normal to have no estrogen. None. They're basically telling you it's okay with us that you have no more protection because since you're an older woman and you're in menopause, you don't need that estradiol. We're going to actually make it look normal for a woman to have no hormones in menopause. The translation of that is it's okay for you to have zero protection of your bones, no protection of your brain, no reduction in your Alzheimer's risk, no reduction in your cardiovascular risk, no reduction in your cancer risk, no protection for your breast, no protection for your heart. That's not okay. That's not okay. They're saying it's okay for you to wither up and die with no hormones because without hormones, you will. You will die a very slow death, and it's not fun. It's not fun. Your brain starts to wither. You're at an increased risk of Alzheimer's, increased risk of osteoporosis, increased risk of cardiovascular disease. Whether we're talking about thyroid or hormones or both together, you are at an increased risk of everything that can kill you without that protection of your hormones. Okay, next up, probably my second favorite hormone. This is the get shit done hormone, testosterone. I talk about this all of the time. Now, this is for women, but I'll also bring up my men because they're on the call too. Total testosterone for women, the range goes from an 8 to a 48 on your lab. So you go to Quest, you go to LabCorp, you literally get cut off before you even reach optimal. Optimal total testosterone is 50 nanograms per deciliter or above. The range doesn't even reach the optimal. Even at the very top of normal, you're still depleted. It's like the range is literally rigged against you to keep you sick. Men, you're no different. Your range starts in the 200s, 250. It gets cut off at 1,000. I want you 800 or above for your total testosterone, 800 nanograms per deciliter or above. So you will get told that your testosterone is normal, even if you're coming in at a testosterone level at 500, 400, 600. That's going to be normal. That's horrible. So free T3, we need that in the upper quadrant of the range. Reverse T3, we need it less than 12. Less than 12. An estradiol of a 12 in menopause is not acceptable. That is not normal. We want it 50 or above. Most women do their best when their estradiol is 80 to 100. And testosterone of a 12, yeah, you'll get told you're normal. You will. But you want that 50 nanograms per deciliter or above as a woman. Normal is a lie. Every single one of those numbers, the free T3 of 2.3, estradiol of 12, that's a crime. That's an absolute crime to tell people that they're normal if you have these numbers. Normal is keeping you sick. Hearing that word normal is keeping you sick. And I want you to remember this forever. Lab ranges are built from statistical averages of sick people. They're not actually built from where you are going to feel your best. And we all know there's a massive difference between just surviving and floundering or functioning at an optimal level and living in optimization land. Lab ranges were taken from groups of sick people, and we don't want to be sick, and we don't want to be average. Okay, so we covered why your normal labs are keeping you sick. Now we're diving into medications. Why your meds are working against you. And this is the one that has 50 million Americans on the wrong medication. Oh, here we go. Thyroid, levothyroxine. There are 50 million people on that right now. Just take your levo. That's all you need. It is the number 2 most prescribed drug in the United States under antidepressants that you'll also get prescribed as a Band-Aid medication for your hypothyroidism and your low hormones. Blood pressure meds are up there as well. Also another Band-Aid. And almost every single person on it is still exhausted, still gaining weight, still has brain fog. Okay, wait, I want to know if you are on T4 only, levothyroxine, Synthroid, put a yes. Just put a yes. I want to see how many people, and you on YouTube as well, put a yes in the chat if you are on T4 only. T4 only, put a yes in the chat. Oh gosh, there's so many. There's so many of you. Oh yeah, Teresa was on Tiracin, hair fell on clumps. Yes, yes, yes. Oh my gosh. Oh my God. Wait, Jewel. Okay, yeah, I see you. I see you. Some people are on NP thyroid. Bear with me if you are. 300, Kathy, on 300 micrograms of levo. Kathy, you better tell me that you are testing your reverse T3. There's no way that it's not high. There's no way it's not high on that much. Okay. Oh, Carol is off levo and doing better. Okay. Truck and crochet, your mom's been on it since you can remember. So if your mom has hypothyroidism, then chances are, yeah, you do too. You do too. All right. Even for my people on T4 and T3, bear with me. Hang in there. Hang in there. So I said this earlier, that T4 only will never, ever work. It will not get you optimized. It won't. And we're going to go into the why. So T4 is the storage hormone. Your body has to take it and convert it into T3, the active form. Most people do not convert well. And conventional medicine, what they are taught in med school is literally you give T4 and that's all you need to do, because everybody's body, don't you know, will take that T4 and convert it. Well, I'm sorry. There are many, many, many things that get in the way with that conversion. Many things. Stress, inflammation, low progesterone. Most women over 40 can't convert T4 to T3 at all, or they really, really struggle. And we have to help them out with that by putting them on the right thyroid hormone replacement. So if you're sitting there thinking, well, but why did my thyroid medication work for like a few months or a few weeks and then stop? That is literally because your sex hormones are driving that conversion. Low progesterone will affect T4 to T3 conversion. Elevated insulin, insulin's a hormone. Elevated insulin will impact it. Elevated cortisol, being stressed out and pumping out that cortisol, will affect T4 to T3 conversion. There are so many things that affect it. Nutrient deficiencies, even genetics. So this is why T4 only doesn't work. Are you starting to see that? Is it starting to make sense? Why T4 only will never get you optimized? It'll never get you optimized. So here's the trap. You're taking T4 every day. You're taking it because your doctor said, here's some T4, take this. That's what I was first put on. When I was first diagnosed, I was put on T4 only. I gave it 5 months and it didn't work. It didn't work. Barbara, the patient that I told you about on the GLP-1, was on T4 only. Her GLP-1 didn't work. So you're taking T4 every day religiously for years, and you're still exhausted. You still got brain fog. You're still gaining weight. You're not losing weight. Doctor looks at your TSH, says, oh, your labs are normal. Pats you on the head, sends you out the door, wishes you good luck, tells you we'll test you again in 6 months. But if you're not converting, then you are still hypothyroid at the cell level. I'm going to say that again. If you are not converting, you are still hypothyroid at the cell level. At the cell level. Now, okay, I saw some of you typing earlier. This is exactly what you were talking about. But I'm on Armor. I'm on ND. I'm on Ren Thyroid. Isn't that natural, right? Those are all NDT. Yes. Okay, we're going to break that down. So is it better than T4 only? Sure. Because NDT medication is 80% T4 and it's about 20% T3. But it is still 80% T4, 80%. Remember how we said earlier, the only hormone that converts to reverse T3, which we're going to talk about more, is T4. So if you're taking something that is 80% T4, it might not work for you. It can still leave you stuck. It's a better starting point. It's better, but it's not always the answer for you. It's really kind of the same trap as Thyroid. And what I see all the time, especially in functional medicine, is that functional medicine practitioners or different hormone clinics, they'll prescribe NDT and they pat themselves on the back like, well, it's better than Thyroid. It's better than those conventional doctors that only give Thyroid. And I go, wait, is it? Is it? Because I can't tell you the amount of patients that we've had come into the practice who was on NDT, who were on NDT, and it wasn't the right ratio for them. 80-20 wasn't working for them. They were struggling with converting. We literally had to reduce the amount of NDT medication they were on and add in T3 to change that ratio, to bring this ratio maybe to a 60-40, maybe a 40-60. Maybe you need more T3 than T4, and you just need a little bit of that NDT with more T3 on the other side. It's all about customizing it for you, finding that right combination in the right dose that is working for you. So if you have been on NDT, and this is classic, If you've been on NDT and you felt good for the first couple of weeks, maybe the first month, and then you started getting hypo again, that's why, because the 80% of T4 in that NDT medication was pushing up your reverse T3, putting your body in this lockdown mode, this survival mode where nothing works. Nothing works. Now I want to move and talk about hormones, because thyroid and hormones play together, and what you're on actually matters. Hormone side has the same problem. Sometimes you can be on the right hormone, just the wrong delivery method. I'm going to give you the example of testosterone. Perfect example. Cream testosterone. If you dose it wrong, it can literally drive scalp hair loss through a conversion into dihydrotestosterone. Pellets, like Karen and I talked about earlier, too high of a dose can literally get you into something called virilization, where you're growing a beard, your voice is deepening, you're getting acne like a prepubescent boy. And here's the thing, you can't take a pellet out. It's in. You have to wait it out. You have to wait it out those 3 or 4 months. Cream in some people can, it can push over to that DHT. So there's no one size fits all. Like bioidentical does not mean one size fits all. The form matters, the dose matters, the route matters, the delivery method matters. You have to find exactly what's going to work for your body. So what do you actually need? Okay, on the thyroid side, yes, we will use NDT, Armour, MP Thyroid, Ren Thyroid. We'll use that, but we're going to use it in the right dose and the right combination. Like I said earlier, maybe adding in T3 to the NDT, or maybe we pull out T4 completely and go straight T3 only. That's what I'm on. Maybe we compound that T4 and T3 so that we can control how much is in each, where we can tell that compounding pharmacy, you know what, I only want 20% of T4 in there. I want it to be 80% T3. I only want 10% T4. I want it to be 90% T3 with this patient. That's what you need, not a one size fits all. Not we're just going to give you Synthroid and just keep increasing your dose of Synthroid. And not, we're just going to give you NDT because there's natural in the title and you feel good and I feel good. No. If you need NDT medication, we're going to make sure that it's the right combination, maybe some NDT and T3 for you. Now on the hormone side, how many of you ladies have started an estradiol patch and it just didn't work to raise your level and you had to go to cream? How many of you are on cream and you're like, it's transferring to my kids, my dog, I want to do a patch? What about oral progesterone? Some of you can't even tolerate it. It makes your breasts hurt, makes your nipples hurt, causes moodiness, causes too much sleepiness. You need the topical, you need the cream. Some of you are really struggling with sleep and anxiety. You need the oral, not the topical. It is all about the combination and working for you. What you don't need is a birth control pill or an antidepressant or another blow off by your doctor. You need the right combination and the right dose for you. So I'm going to give you an example. I love Miss Amanda. Meet Amanda. She was 220 pounds and she was miserable. She went to a functional doctor and then a thyroid expert, and they had her on natural desiccated thyroid because she thought it was natural. They were all happy that it was natural. And they thought, hey, we're doing a better job than giving this person T4 only. So good for us. It's the same trap. Same trap. Her reverse T3 was through the roof. I will never forget the day that I talked to her on the phone and she was telling me what she was taking. And I said, I think you're like me. This just sounds like me. I think you're T3 only. I just do. And sure enough, her reverse T3 was through the roof. She's T3 only. She requires T3 only, and some of you will. Some of you will only need T3, the active thyroid hormone, because you add in T4 and it pushes right over to reverse T3 and it makes you so hypothyroid. So hypothyroid. And oh, by the way, she also wasn't on testosterone. Her poor testosterone was a 12. That was the example that I gave earlier. A testosterone of a 12, and they told her she was normal because she fell in within that normal range. Her marriage was struggling because she didn't want to have sex with her husband anymore. When we actually added in what she needed to do, it saved her marriage, and her husband became a patient because he couldn't keep up with her. That's what optimizing your thyroid and hormones can do. All right, so here's the takeaway from point 2. T4 alone is going to fail you. I say most because I'm sure there's an outlier out there. I'm going to say 99.9%. T4 only, not going to work. NDT, still mostly T4. You need T3 in the right form at the right dose. You need bioidentical estrogen, progesterone, testosterone together because thyroid alone is half the answer. Hormones alone are half the answer. You need both. And that is point 2. Okay, here we go. Point number 3, why your body is storing fat instead of burning it. And this is the one that's keeping a lot of you up at night, right? This is the chemistry of stuck. All right, so let's just talk about something. The weight loss model. I mean, if you're a child of the 80s, 90s, even early 2000s, you've heard this over and over again. Calories in, calories out, right? That's the belief. Eat less, move more. Maybe you've even been told that by your doctor as well. This is the only tool that your doctor has in his toolbox, by the way, for weight. So when you go in and you say, Doc, I'm gaining weight, I can't lose weight, they're going to be like, well, I think you need to eat less and maybe move a little bit more. Have you been told that, right? So when you walk in and you say, like, listen, I am doing everything. I walked in with my diet written out. I handed it to my doctor. I'm doing everything and I can't lose the weight. What do you think he reaches for? He doesn't check your thyroid, doesn't check your hormones, doesn't address those. Because in the old model, the thyroid and hormones don't run the show. Calories do. Calories in, calories out. But here's the truth. You could lower your calories to nothing and still gain weight if your thyroid is in the toilet. Your thyroid and your hormones run your entire body. Sleep, mood, libido, hair, and yeah, your ability to burn fat, 100%. That is your thyroid is the regulator of your metabolism. Your hormones come in and help out and play a role as well. So there's no amount of eat less and move more that is going to fix it. You can't out-discipline low thyroid function and low hormones. You can't out-discipline a hormone problem. So if the model is broken and the doctor's only tool in the toolbox in this broken model is to tell you to eat less and exercise more, then what's the next step? What is the next step? This is where it just gets even better. So you say, well, doc, this is what I'm eating. My calories are really low. Oh, well, then it must just be menopause. It's just your age. It's just stress. These 3, I know every woman in this room has heard at least one. I know it. Most of you have heard all 3, but you've at least heard just one. I'm not even going to ask you for it, okay? Those 3 sentences have ruined more women's bodies than anything else in modern medicine. I'm going to say that again. Those 3 sentences have ruined more women's bodies than anything else in modern medicine. They are not answers. They're certainly not a diagnosis. They're an excuse. An excuse a doctor uses when the only tool in his bag, the calories in, calories out model, doesn't quite fit the problem in front of him. So, they're just blow-offs in a lab coat. You go home thinking it's you. You're blaming yourself. It's not you. It's the model, and the model is broken. Now, stay with me. I'm bringing something around here. Remember earlier tonight when we talked about normal labs in point 1, remember the 2 numbers that I showed you, pre-T3 and reverse T3. Those weren't random. I pulled them because they are important. I showed them to you for a reason. And we're going to come back to them because they are the entire answer as to why you can't lose the weight. Okay, estrogen dominance and low progesterone play a role here. And this is a pattern that I see hit every single woman in her 30s, 40s, and 50s. And this pattern will drive reverse T3 through the roof. So here they are again, the same two labs that we looked at back in point 1, free T3 and reverse T3. But this time, we're not talking about whether or not they're normal. We're talking about what they actually do to your weight. Okay. So your body actually makes two kinds of T3. One of them burns fat. That's the free, unbound T3 that we love to see on your labs, and we want it in the optimal range. The other one, reverse T3, literally stores fat. So it's this mirror image, but a totally opposite job that they do. So this is the switch that I was talking about. On the left, free T3, the good one, the active one. This is the hormone that burns fat, gives you energy, wakes up your brain, keeps you warm, all the things. Free T3, yay, that's the yes. Woo! On the right, reverse T3, the imposter, the imposter. It's like the same structure, but flipped backwards. It doesn't burn anything. It blocks your receptors so the good T3 can't get in. It tells your body, reverse T3 will tell your body to store fat. Hold on to it. This person is in survival mode. Reverse T3 is your survival mechanism. It's the brake. It's the thing that protects your body. Again, if you're lying in the ICU or the ER and you are in this major traumatic accident, we want T3 to be elevated because we want your body protected. We don't want it elevated when you're walking around trying to live life. So reverse T3 is the no. So go back to that woman from point 1, the free T3 of 2.3 and the reverse T3 of a 22. Her doctor called both of those normal. But now you know what those numbers actually mean. She wasn't normal. She wasn't running her metabolism on the no hormone, on the reverse T3 hormone. She could starve herself. She did. She tried. She could live at the gym all day long. Her body was never going to let go of a pound because biochemically it was locked in storage mode. Which one do you think your body is making more of right now, especially those on T4 only? Because remember, you're doing everything right. You're eating clean. You're moving. The scale's going up. It's not a calorie problem. It's a reverse T3 problem. And here's the part about bringing them together. The part no doctor will tell you, estrogen dominance and low progesterone. The exact hormone pattern that we see in women in their 30s, 40s, 50s, because that is when your progesterone starts to decline. By your 40s, 50s, it's in the toilet. That drives reverse T3 up. So as your hormones go sideways, your fat storage hormone climbs at the exact same time. And this isn't a coincidence. This is why thyroid and hormones have to be fixed together. So I always say, reverse T3 is like the bouncer at the club, right? The bouncer at the door of your cells. So he's waving in the fake IDs, the reverse T3. Yeah, come on in. Reverse T3, you can come in. The real free T3 with the real ID stuck outside. He's stuck outside. He can't attach to the cell. It's like your doctor standing on the sidewalk going, looks fine to me why your weight won't budge. It's all good. Here's what's literally happening inside your cells. So reverse T3 is kind of like the imposter, right? It looks like T3, but it's not. Sits on your thyroid receptor site. He's in the seat. He's in the seat of the receptor, but he's not leaving. And all that T3 in your body, that free T3 floating around, ready to attach, it's got nowhere to go. The door is occupied. So your cells starve. And the worst part is your doctor doesn't even know this is happening because he isn't testing for it. She isn't testing for it. They're looking at your TSH and calling you normal and sending you home. Meanwhile, every cell in your body is in a fat storage lockdown mode. Now, I want you to hear me on this point. You cannot exercise your way out of this. In fact, over-exercising will drive it up. You do that CrossFit twice a day, It's actually going to drive up reverse T3, but you're in this desperate mode. You just want to lose the damn weight. Well, you can't diet your way out of it. You can't starve your way out of it. And the scale isn't going to move unless you clear and reduce your reverse T3. Sky high reverse T3 means you're on the wrong medication. When you actually get the right protocol, things actually start to move. So I'm going to show you the impact of an elevated reverse T3. And we talked about that. Gabriella. I want you to meet Gabriella. She's a patient. You'll actually see her in the Just Fix Your Thyroid Facebook group too. So she had an elevated reverse T3 and she was struggling with fertility. She actually had a couple of miscarriages because low thyroid function is the number one cause of infertility and miscarriage. So she had a couple of miscarriages, really, really impacting her marriage, really hard. So she came in, we tested her, elevated reverse T3. She was on T4 only, of course. It was starting to affect her hormones. Her progesterone was low, even in her 30s. So we add in T3. We clear out that reverse T3, drops it down. Hormones start to become balanced, and she gets pregnant. And she gets pregnant again. So she has 2 babies. She successfully completed her goal of running a full marathon. There was one point in time I was using her pictures. You've seen Gabriella before. She ran a half marathon. Well, I had to update the slide because she ran a full marathon and she started her own business. That is how fixing your thyroid can affect other areas of your life as well. Yeah, she lost the weight. She's much more healthy. That allowed her body to accept and maintain a pregnancy, 2 of them. But she also got more confident. She saved her marriage. She started a business. She's hitting her goals. Like she is literally living her best life. Reverse T3 was silently blocking what she wanted to do. So I just want you to know, truthfully, really want you to know that it is not your fault. It is not your fault. Normal does not mean optimal. We have to test the full panel. We have to know exactly where you are falling in that range. Your medication is working against you, especially if you are on T4 only, or if all you're taking is NDT and you have symptoms, then your meds are working against you. If you're not on hormones and you're over the age of 40, you need bioidentical hormones. And if you have an elevated reverse T3, then it's literally blocking you chemically. Nothing can work in your body. You can't lose weight. You can't light up your brain. You can't even poop every day with an elevated reverse T3. And we all want to poop every day. So here's the picture that I want burned inside into your brain. I got thyroid on one side, got hormones on the other. And that overlap in the middle, that's where you should live, right there. That overlap, when things are optimized, means you live your best life and the symptoms that are associated with thyroid and hormones disappear. But if you are living in that circle, in that middle, and you're not addressing your thyroid and hormones, that's where the symptoms live. That's where your symptoms come from. Until you address both, you're not going to lose the weight. You're not going to get your libido back. This is why so many women spend years bouncing between their OBGYN, who they think should know hormones, their endocrinologist. That's supposed to mean your endocrine system, right? Your thyroid. And the primary doctor, which doesn't understand either. And then nobody's connecting the dots. Nobody's treating that overlap. And that overlap is where you fix your thyroid and hormones together. All right. I want to see you guys. Is it starting to make sense a little bit? Just drop me a yes. Drop me a wow. Drop me something. Starting to make sense. Yeah, no, don't go to another endocrinologist appointment ever again. No, I wouldn't even waste your time on OBGYN, honestly. They don't know hormones. They can deliver a baby and they can do a pap smear. In endocrinology, they can treat your type 1 diabetes and they can give you metformin for your type 2. But they are not going to treat the root cause. They're not going to treat your thyroid and hormones properly. They're just not. Well, who do you see? Girlfriend, stay with me, Tammy. Stay with me. Doctors are here for illness mostly. Yes, Deanna, I know. All right. Hang tight. Thank you for understanding. I'm glad. All right. So let me get the chat here. All right. So I want you to look at this list again. Same list I showed you at the very beginning, right? Thyroid on one side, hormones on the other. An hour ago, this was just a list. This was like a list of stuff that you are dealing with. That's like, the forefront of our mind. Like I'm gaining weight, all of that. But now you know the why behind every single one. You know the lab that we need to check. You know the fix. But here's the thing I want to sit with you on, because at the beginning, I was asking you, okay, count the symptoms. How many do you have? Okay. And you type all of them and 15 and 23 and all of that. But that's only half the story, because this list is not just a list of symptoms. It's kind of like, I want you to look at it as like a worksheet. Okay. This is a list of everything that's been stolen from you: energy, sleep, your body, your confidence, your joy, the patience with your kids, the presence with your partner, the desire for your partner, the version of you that used to laugh and say yes to everything because you wanted to go out. Every symptom on this list stole something. So I'm not going to ask you to count them again. I'm going to ask you something a little bit harder. So I want you to open up to me in the chat. You're my VIPs. Open up to me. I want to see, what is the one thing you've stopped doing because of how you feel? Just name me one. Just type it out. Just one. I'm sure there's a lot. But before you do, I would make this real, because I know what you're sitting on. I've been in this room with a million women. I know what comes out when I ask this question. I've asked this before. So let me say it for you. Let me give you some ideas, because some of you can't even bring yourself to type it. Was it a night out with your friends? They invited you, you wanted to go, and then 5 o'clock hit and you're like, I'm so sorry. I have a headache. I can't go. You didn't have a headache. You just couldn't stand the thought of getting dressed and pretending to be okay for 4 hours. So you sat on the couch alone again. Were you avoiding sex with your husband? You used to want him. You used to initiate. Now your libido's in the trash. And like I said earlier, you don't want to look at you naked. You don't want him to look at you naked. You shower with the door closed. You avoid the mirror when you're getting out. I know, I've been there. You change in the closet. Maybe he reaches for you. She reaches for you in bed. You stiffen up, pretend to be asleep. And then you cry the next day because you remember what you used to be and you miss that person. Or it's the pictures. You're avoiding the camera. We've all been there, avoiding the camera. Maybe it's your kids that you're avoiding. Maybe you just don't have time. You're avoiding vacations because you don't want to gain 10 pounds on a vacation. Like Lisa, you skipped 4 years of family vacations because she couldn't bear the thought of being on a beach in front of strangers. 4 years of memories gone because you're hiding in your house. What is it for you? Okay, let's see. Oh, Susanna, neglecting myself in every aspect and hiding. DJ, you're avoiding dating and you're avoiding life. Yes. Jamie, you're crying because this is you. I get you. Terry doesn't even have a mirror. Yeah. Carolyn, buying new clothes, especially dresses. Oh, girls, ladies, guys, my heart. Bobby, traveling and just having fun like I used to. I worry about fatigue while traveling. I just feel uncomfortable. And yes, I avoid the camera. And it just keeps going. Hate my puffy face, buying new clothes, even bras don't fit. Yeah, that is why you're here. That is why you are learning, because this is what you are going to get back. You are going to get this back. I know this was heavy. I know, but I need you to hear me. The person that you miss, the woman you miss, the man you miss, the person you know that you are is not gone. Is not gone. Just buried. You've been dismissed. You've been misdiagnosed. You've been undertreated. But the best part is this is fixable in weeks, not years, weeks. So all of that, like Sue's misdoing her art, takes your life away, never look in the mirror, all of that, what you just typed, that's what we're getting back. We're getting back the date night. We're getting back to sleep. We're getting back to sex. We're getting back like you saying yes You saying freaking yes, finally. And let me show you this real quick. One more thing. It doesn't get better by waiting. This is what can happen. You can be vibrant. You can be energized. You can work out again and actually not be fatigued afterwards and need 5 days off after you work out. But the reality is it's not going to get better by waiting. Yes, you can be empowered. But what happens if you do nothing? All of those symptoms, like I said, starts to yell. They start to scream. You get worse. You start shrinking your life around your symptoms. Less travel, less intimacy, less confidence, less energy. And if it goes untreated, it's going to get worse. And then the other things that we talked about as well, those longevity aspects, your brain, your heart, cancer, that can start to express itself as well. So we don't want to sit here paralyzed. We want to do something about it. So this is the place where you have two choices. Choice one, you can do it alone. Trial and error, keep doctor jumping. Absolutely. Absolutely. 2 sets of labs, different offices, years of guessing. I get it. You could totally do it alone, or you can do it with me. A proven path. Thyroid and hormones treated together. One prescriber for both sides. Your body back in weeks or months, not years. Not years. That's what I want to talk to you about. I am so excited to share an answer with you that I have been building for so long. The Total Thyroid and Hormone Fix program. That's what this is for, is getting your life back. This is the room. This is the place. This is the thing you've been trying to find for years. And this is the thing that your doctor couldn't give you. This is the thing that your functional medicine practitioner missed. The thing your husband can't fix, the gym membership can't fix, the next diet, next supplement, next protocol, next podcast, not going to fix it, because all those things only address half the problem and sometimes none of it. And tonight, you know why. You need to address both thyroid and hormones. Thyroid and hormones. Because the woman I used to be needed this, and I refused to let anyone. That's why I started what I started years ago. I refuse to let any of you keep looking for it elsewhere. All right, so let me tell you exactly what it is. It is 12 weeks together, 12 weeks built for the woman that you are about to become. And here's the thing. Not every woman out there can afford one-on-one care. All right, we put the link in the chat. Yes, we do one-on-one care at the Advanced Thyroid and Hormone Clinic, but I wanted to build something that was affordable and effective, because every single person deserves high-level care. So we built this because too many people out there are being dismissed and misdiagnosed and forced to figure this out alone. And I know what it feels like to bounce from doctor to doctor. I know what it feels like to be depressed. I know what it feels like to cry in my car when you're searching for answers while your body literally I kept gaining weight. I kept gaining weight, doctor after doctor. And I also know that not every single woman can afford one-on-one concierge care, but every woman deserves it. Every person deserves it. The right labs, the right prescription, the right guidance, and someone who actually understands how thyroid and hormones work together. So that is why we built Total Thyroid and Hormone Fix. So you finally have access to the same strategy and expertise and support that we give you in the one-on-one clinic. So for years, you've been trying to figure this out alone. You're Googling symptoms. You're begging your doctor for labs, wondering why nothing is working. This is the moment that changes, because inside Total Thyroid and Hormone Fix, you are finally guided through this step by step by people who actually understand how thyroid and hormones work together. So first, and this is the most exciting part. This is the most exciting part. You finally get the answers that your doctor missed, and you get the prescriptions that you need. No more your labs are normal. You're actually going to get comprehensive thyroid and hormone testing, and you're going to learn how to read your labs, and you're going to learn exactly what thyroid and hormone replacement you need. And then you will actually get the bioidentical hormones you need, the thyroid hormone replacement you need. No more begging, no more doctor jumping. You're going to finally have access to a team who understands both sides together. Both sides together. And this, I know, Jamie, I know this is what you need. So we are also going to give you a protocol, step by step, to prime, optimize, and then lock in healing your thyroid and healing your hormones. Most people are overwhelmed because they don't know, what do I fix first? We do it both together, and I take your hand and I guide you through it. So instead of randomly trying out supplements and diets and workouts and medications, you're going to finally have a clear roadmap specific to you for getting your body back. And you're going to be with me. You're not doing it alone. I'm going to be with you every step of the way. We are going to be together for 12 weeks. Every single week, once a week, we are going to be hanging out. You are going to be learning. So you have me every week. We're going to laugh. We're going to learn. We're going to answer your questions. And we're going to get you into optimization land with me so you can experience your best life ever. You're going to learn what your labs mean. You'll learn and be empowered to know exactly what thyroid and hormones you need and in what dose. Yes, you can have this kind of power. Absolutely. And maybe one of the most important parts, you're going to stop feeling alone in this. Every week, you'll have live coaching and support from me, and you get to interact with women who understand exactly what you've been going through. No judgment, no dismissal, no pretending anymore, just real support while your body heals. And I truly believe that you heal in community. So I'll be in there. My nurse practitioners will be in there as well, supporting you and answering your questions in our community. And you're going to finally get answers for, what is this GLP? What is this? What do I need to be doing? What's the right dose? What is a micro dose? I understand the confusion, and I'm going to teach you about peptides and GLP-1s, in addition to the thyroid, the hormones, and the BHRT. And yes, all of our calls are recorded, so you won't miss a thing. You're going to finally get answers, and you're going to get outcomes, like real outcomes, like your body changing, your energy coming back, because you're going to finally get the right prescriptions on both sides. You're going to stop begging your doctor for what you already know you need. You're going to stop guessing. You're going to start fixing both sides. You're going to feel like you again. Not in years, weeks, months. But honestly, this isn't really about labs, prescription, or protocols. Protocols are great. The prescriptions are great. But at the end of the day, it's about you finally having answers, understanding what's happening in your body, stopping this cycle of doctor jumping and doctor Googling, and just settling into actually feeling how you're supposed to feel, feeling like you again, clear-headed, energized, confident, present, and enjoying your life. All right, so let's talk about some of the really fun bonuses we have in Total Thyroid Fix. Yes, I'm getting to the price. Just hold on. We got to talk about these bonuses because I know how hard it is to get your doctor to order the right labs. They'll only test TSH and free T4, or they're only testing estrogen if you're a woman. No, we need to look at the full picture, and labs should not be a sticking point. So we're giving you the lab order you need. So bonus number one is your full lab panel, thyroid and hormones, full set. This is a $350 value because that's literally what we pay Quest and LabCorp for your lab order. We're just giving it to you. We are giving it to you. And if you've tried to piece all of this together on your own, the labs, the appointments, the prescriptions, the hormone support, thyroid optimization, coaching, trial and error, all of that, you know, there's this missing component called your mind and cravings. So we are adding in ThyroSlim Reset because I don't want this to be a sticking point for you. I want you to be able to clear the mental blocks that are sabotaging your results. We are throwing that in for free. So I know this, you're going to look at it and go, oh my gosh, I can't afford that. Nope, that's okay. You're not going to pay that, but that is absolutely what it is worth. 1,000,000% that is worth. But I also want to make this affordable. I don't want price to be the reason another person stays stuck. So here's everything that you get, and here's the true value. You know, we always do this. We always add up the value. And a lot of times you're on these calls and you're like, that's not the value. This is the value. Because 12 calls with me, it's actually more. But I just started thinking, like, if I did 12 weeks of phone calls with people live and I'm teaching them, you know, this is what I would charge. And then we have the full thyroid and hormone lab panel. That's $350. And the Thyroid Slim Reset sold on its own is $1,500. So it literally is worth $4,847. But you're not paying that. And you're not paying $29.97. You can literally start today for $597. 3 payments of $597. Now, if you really want to pay or save money and save $300, you can pay in full. $1,497, pay in full. And we're going to be popping the links in the chat for you to click on. $597 gets you started. That is $15 a day to literally buy back your poor little hijacked body that's like a runaway train right now. You can start for this amount. Like, that is nothing. Okay, but I always like to, I'm a type A driver. And a lot of my patients, a lot of people I work with, they are type A drivers as well. They know what they want and they go for it and nothing stops them. So I know a lot of you right now are going to be signing up. We're going to be working together. And because you are like, hell yes, I want to get my life back. I'm ready. I'm done avoiding the vacations. I'm done avoiding going out. I'm done avoiding sex with my husband. I'm done losing days, weeks, and life of my years, months of my life. I'm done with it. For those of you who are like, bam, I'm in, we're going to give you a fast action bonus just for right now. Now, literally, once this ends, this goes away. So this is for my fast action people. You're going to get a $150 Fixer Formula supplement gift card plus a lifetime 10% discount for life. Once I close the cart, once we end today, it's gone. And I'm going to tell you something real quick because you're on this call right now. And remember, there's no replay. So you literally get insider information. We're having a buy two, get one free Memorial Day sale. So if you join today and get your Fixer gift card, that $150 will get you like stocked up and ready to up level your health. Like, you're going to get double bang for your buck. So even if you want to stock up on amazing protein, you get more bang for your buck. You're getting this gift card today. Save it for the Memorial Day sale. And then ongoing, you're going to get 10% off anytime, anything you need. Yeah, grab the Hashimoto support, grab the thyroid fixer, or even if you just need really amazing protein powder or vitamin D or magnesium, you are covered. You are absolutely covered. So I wanted to share that little secret with you. So this is the total value. Like I said, when we add in the $150 gift card and 10% lifetime discount, that bumps it up by an additional $150 plus. So we're over $5,000 in true value. But again, you get it for $597 right now. And then you don't have to come up with it again until next month. So let's actually decide. Let's decide right now what your next step is going to be. After we get off this call, when all is said and done, the price is going to go up. It's going up to $16.97. The $150 Fixer gift card will be gone. The 10% lifetime discount will be gone. You'll just pay a higher price if you really want to sit on this and wait on it. But for my fast action peeps, I want to see you inside the program because I know that you want that gift card and I know you want 10% off for life. So really right now you have two choices. The link is in the chat. We're going to be opening it up for questions, but you have two choices. You can keep feeling like crap or you can do something about it. So now, I mean, you've learned so much about how your body works and the importance of thyroid and hormones going together. Let's do this together. I built this for you. I built this for you. I heard you. I know you. I know what you're looking for. And this is something I've been working on for so long, so long. So I'm going to open it up for a Q&A. So make sure you put your questions in the chat. I'm going to go over a couple of questions right now because I want to address that which I know is on your mind already. So you're saying, wait, I'm not sure if I have a thyroid problem. If you have symptoms, and we've been talking about this all day, if you have symptoms, then you have a thyroid problem or a hormone problem or both. Those symptoms tell you that something is off, something is wrong. Remember, we don't ignore our symptoms. I'm in menopause, but is this still built for me? My gosh, yes. I don't care whether you're still cycling, you got wacky cycles in perimenopause, or you are in full-blown menopause. If you're in peri or meno, you need hormones for sure. Even if you're younger and you have heavy cycles and your thyroid is off, let's treat your thyroid and let's give you that beautiful progesterone that you need, because that's why you have those heavy cycles. Yes, it is for everyone. It is for men too in andropause who need that beautiful testosterone. Does it include supplements? No, we do not include supplements or medications as part of this program. Your lab order is included, yes. Your meeting with the prescriber is included. All the meetings with me are included. Your entire box of recorded content is recorded or is included. The ThyroSlim is included. Supplements are not, medications are not. When are the calls? So we're kicking off on June 4th. That is our first call. And the times and days I'm going to rotate and move them around so they can fit a range of schedules and time zones. All the calls are recorded though. So if you have to miss one, not a problem. Not a problem at all. And remember, you have the community as well to ask your questions. What if you're already on BHRT? If you are already on bioidentical hormone replacement and you still have symptoms, then you're not on the right BHRT protocol. I can't tell you the amount of people that have come into our practice on Glow, oil-based hormones, it never moves their hormones, or they're on pellets and the pellets jack you too high, like we talked about earlier. If you still have symptoms, you're not on the right bioidentical hormone replacement. And yes, you have to live in the United States for prescriptions to be written. You're welcome to take part in this and learn, because you're still going to learn. I am going to teach you how to read your labs. I'm going to teach you how to determine what thyroid and hormone replacement you need and in the right dose. If you live in a country outside the United States, we won't be able to prescribe for you, but we will be able to tell you exactly what you need. And then you will just have to source that by working with a doctor or self-sourcing your medication. So the prescriptions are only for people in the United States. All right. I just want to inspire you a little bit with some before and afters while I take your questions. Oh my goodness. What if you're on a hormone blocker? So if you are on a hormone blocker, we would say, okay, why? Why are you on that hormone blocker? Obviously for cancer in the past, but do you need it, or do you want to explore possibly adding in hormones to protect you from recurrence? Can scripts be written for snowbirds while in the United States? Absolutely, Miss Tina. Let's see here. The cost of labs is included. Yes, your first set of labs are included. That first set of labs are included. Laura, does helping thyroid cure PCOS? It doesn't cure it, but I also had PCOS. They often go hand in hand, because remember we said the thyroid is the master gland and it literally controls your hormones below. So if the thyroid is the master, then, and it's off in any way, shape, or form, like we saw with Gabriella, hormones are going to be off, progesterone is going to be low. It's not a good place to be in. And that's going to increase PCOS's effect on the body. Because with PCOS, we'll have low progesterone, estrogen dominance. That's going to affect your thyroid and your conversion. But just that low progesterone alone is going to cause heavy cycles, mood swings. It's going to impair T4 to T3 conversion. So yeah, it absolutely goes hand in hand, Miss Laura. Okay. Do you offer a prescriber option for education and an affiliate prescriber? Stacy, I'm not quite sure what you mean by that. Let's see here. Miss Connie. No, you're good to go. Yeah, you're good to go. So we actually moved you into this program even before it started. How often do I need labs? So Eric, you're going to start off with that first set of labs, and that is included in the program. And then as you move through the program, if you decide to continue with us, then you'll just get a second set of labs. We normally like to test right around the 60 to 90 day mark to make sure what we're doing is actually moving the needle and pushing you forward. What happens after the 12 weeks with future lab work and prescriptions? We got you covered, Philip and Stacy, we got you covered. So you'll just move into basically a maintenance type of a program where you'll continue getting your thyroid medication and your hormones. How much are the thyroid meds and HRT in general? So it's really hard to say because it just depends on what you need and the dose that you need and the combination that you need. Some insurances will cover it. Some will go to compounding. So it's kind of, it's hard to say an in general amount because everybody needs something different. Everyone is so unique. Let's see. Okay. How do we continue? I answered that one. What about post-menopause and hypothyroidism? Yes, Tammy. So you need hormones. Even a woman in menopause still needs hormones. Like we need those hormones to survive. We need our hormones to have our best life. So absolutely, we need hormones. You know what? I am actually going to put up there we go, a QR code. So for people that are like driving and whatnot, oh yeah, I can't. Oh, you're up there. Okay. And maybe you can't click the link. Well, if you're driving, you probably can't take a picture of the QR code either. You can go to fixyourthyroid.com/join. That is fixyourthyroid.com/join. Renee, you can't start on June 4th. So what? No, we can't delay your start date because it's a group program. So we're all starting on June 4th, but it's recorded. That first one is just going to be a really big kickoff. We're going to be going over how to start, all the different things that you need to do, getting your labs, working yourself, working around the program. You're not going to miss a thing. That will be recorded. You will be good to go for the week after. Will you write prescriptions for thyroid and hormones? Yes, absolutely. Absolutely. In this program, is there one-on-one consulting time with you? No, there's not. So this is a group program. That's why we're making it super, super affordable. If you want that individual one-on-one time, that's what our clinic is for. In the clinic all day long, we meet with you individually for 60 minutes, half an hour. We have multiple meetings with you on a one-on-one basis. If that speaks to you more, then you're going to book a call with our clinic to find out more about those one-on-one programs. This is a group program. I am going to be teaching you every single week how to read your labs, your thyroid, your hormones, and the other labs that are correlated in there. And you're going to know exactly what thyroid medication you need and in exactly what dose. And exactly what hormones you need, the beautiful bioidentical hormones, and in exactly what dose. And then we are going to prescribe that for you, but you are going to learn, you are going to be empowered, you are going to know, you are going to be in the driver's seat with this. So if you do want a one-on-one deep dive, that is totally fine. That speaks to people as well. But we built Total Thyroid and Hormone Fix to make it super, super affordable, so that there's no blocks for anyone that we all need proper thyroid hormone replacement. We all need bioidentical hormones. If you're over the age of 40, you need it. We all need it, but it's not accessible to most people. The prescribing part is the hardest, getting a doctor to prescribe the medication. Actually, when we did Total Thyroid Fix last year, we didn't have a prescribing option. And I wanted one. So we actually started Thyroid Hormone Fix last year. And I would give everyone self-sourcing options. So you could find the medication and the hormones in other places, like ordering from All Day Chemist or India or wherever. Then I'm like, not everyone is comfortable with that. Not everyone wants to order meds from overseas. And then there were medications that were available, then they weren't available, and just got so confusing. I was like, stop, just stop. I need to build this out for these people. We need to get them the thyroid medication and the hormones that they need, So that is why we built Total Thyroid and Hormone Fix and added in that prescription option. Those of us in the male species, Michael, I got you too. Absolutely. Tony, no, if you can get the labs on your own, we don't give a discount. It's just something that is included in the package. It's already included in there. Mary, I already set up an appointment with your group for next week. Do I also need to sign up for this, or can I still sign up after my appointment next week? Yes, you can sign up after your appointment next week once you decide whether you want to do the one-on-one or this program, Total Thyroid Hormone Fix. The only thing that will be gone, Miss Mary, is the $150 gift card, that fast action bonus, and the 10% off Fixer formulas for life. And the price will go up. So remember, today, if you're thinking about this program, today is the day. Mary, I would say if you're undecided, I would lock yourself in. And if you decide to go the one-on-one route, we'll just refund you for this, or we'll apply this to your one-on-one program. You have nothing to lose by joining Total Thyroid and Hormone Fix. It doesn't start until June 4th. So even if you join now and then you decide that you want to do a one-on-one program instead, you can absolutely do that. Zan, we don't have a discount for this for a husband and wife participating. We do give discounts in the one-on-one program for, husband, wife, mother, daughter. We see that all the time as well. Absolutely. Let me see if I have any over here for these guys. Miss Paula, how can you prescribe for so many people all at once? I'm really confused and overwhelmed. It's because I have a great team. I have a great team and a great system that we built out. So we got you covered. Don't worry. We test things before we throw it out there, Miss Paula. How long are recorded sessions available? So, Miss Karen, you will have them available you're going to go through Total Thyroid and Hormone Fix. You're going to have 12 weeks to go through those. And then we always leave that option. We keep it open for at least another month afterwards for anyone that is needing a catch up. So you'll have access to that as well. Is there a refund or money back option, Miss Leslie? So if you decide before June 4th that it's not right for you, then of course we will give you your money back. I would obviously encourage you to give it a try. I mean, you know that this is right for you if you have symptoms, if you're not on the right thyroid hormone replacement, if you're not on the right bioidentical hormone replacement, if you have symptoms, then this is pretty much right for you. Where do we go to get the labs drawn, Pearl? You can go to Quest or LabCorp. Quest or LabCorp to get those labs done. If I pay for a Dutch test, can you help interpret it while I'm in the 12-week program? No, Juliet, we don't do the Dutch test in the 12-week program because it's going to take that long just to get through the thyroid and hormone component and really get everyone situated in those two arenas, whereas the Dutch actually would take another 6 to 12 weeks to really dive into and teach you how to interpret your own Dutch test. We did it in a program last year. It's a challenging test to learn. It really is. It's a challenging test. Let's see. If you've had cancer in the past twice, are hormones possible? So Linda, yes, that is my belief system. You ultimately have to get comfortable with it at the end of the day. So we can give you all of the information, all of the empowerment to to know that what you are doing for your body is right and that hormones protect you against cancer. But at the end of the day, you have to be comfortable with that. You have to be comfortable with it. Let's see. Okay. Julie, I can't tolerate even 5 micrograms of T3 only. Had to switch to NT. Nothing has changed. Shaking gone away. Reverse T3 is consistently in the low 20s for the last 3 years. That's way too high. I'm with a doc who's learning, but I think she's in over her head with me. I feel stuck. What should I do? So for you, Julie, what I would try, I mean, yeah, absolutely, you can join us, or you can do the one-on-one program where we can go a little bit deeper with you. But what we do for people who can't tolerate even 5 micrograms of T3, number one, we got to check ferritin levels. We got to check your cortisol. That would probably, be a little bit more in the one-on-one program. But what you could do is also try taking that 5 micrograms with some food, because that slows the absorption. And sometimes that's enough to get people to tolerate it. And then we could always prescribe you slow release T3. But yeah, if you have reverse T3 in the low 20s, until we get that down, we got to change your NP dose. Until we get that down, your body is going to be just stuck. It's going to be locked down. Okay, let's see. Jay says constantly working on thyroid numbers. Just began BHRT after breast cancer treatment and forced menopause, and I'm now just continually gaining weight despite eating well and exercising consistently. I am usually not hungry, so not overeating, but eating well. How can I stop this weight gain? So again, we have to check your thyroid, girl. We got to check it. And just because you're constantly working on your thyroid number, so let's get that fixed first, because that is your master gland. That is your master gland. And let's check your hormones too, because I'm wondering if your bioidentical hormone replacement doesn't need tweaked a little bit. I mean, maybe it does. Maybe you're not on the right BHRT for you. Let's see. Mary says, I fit the profile for all of these symptoms, but I'm not interested in losing weight. Would I still be able to healthfully maintain or gain weight? Yes. I mean, that is, yeah. You can maintain your weight by eating more if you have that fast of a metabolism. It's all of, not every hypothyroid patient gains weight. Most do, but not all by any means. Let's see. Okay, we got Julie's. Okay, I got that. No, we can't delay the start date, but it will. Everything is recorded. Everything is recorded. And then we will have an option after the 12 weeks to continue in the program, to continue getting your prescriptions absolutely all day long. Okay, show the cost again. Yes, absolutely. Let me go back. You can start today for $597, flexible option, 3 payments, or if you want to save $300, if you pay in full, it's just $1497. I mean, I can tell you, oh, hi, iPhone. I don't know your name, but you just got the program. You just signed up. That's awesome. Welcome. Oh, and Kelly signed up. Kimberly signed up. You're amazing. Yay. I can't wait to see you in there. That's incredible. Yes, we prescribe, Diane, we prescribe thyroid and hormones, and we will do GLPs. We'll do microdosing GLPs too for those who need it. Absolutely. Okay. Let's see. And like I said, you can start today for $597, and that's just 3 payments of $597. Thank you for being a wealth of knowledge. Suze, thanks for being here. You've been hanging out with me today. I love it. Linda H., thank you so much for all of this valuable information. I feel like health is actually within reach now. Bam. Yes, Linda, it absolutely is. Are the compounded hormones made with clean ingredients? Yes. Most compounding pharmacies honestly use very, very clean ingredients. Yes. It's very rare that a compounding pharmacy would use anything but, and the ones that we use are top notch. Let's see. what about a cruise in July? Will that blow my results? Well, no, Joan. What you want to do is actually get on the right path before your cruise. And then that way, like maybe you come back from the cruise like 2 pounds overweight instead of 10 pounds overweight, right? Okay. Let's see. Misty, yes, the one-on-one program is exactly that. It is one-on-one. So let me break this down and be clear. So Total Thyroid and Hormone Fix is a group program. There's no one-on-one meetings with anybody except a 10-minute meeting with a prescriber. So that's the only one-on-one meeting you get. And in that meeting, all they are doing is looking at the form that you filled out because you are literally learning. I mean, this is going to be work. The one-on-one program is kind of like done for you, basically. You just sit there, you talk to us, we ask you questions, you get your labs done. We're doing everything. We're making all of the decisions. We're meeting with you in deep diving. In the one-on-one, you meet with a functional diagnostic nutritionist that builds out a nutrition and a lifestyle program and a supplement protocol, and you have access to them 24/7. You meet with a nurse practitioner that dives into your labs, like all of them, not just thyroid, not just hormones, all of them. If you have a more complex case, you need a functional test, like we need to look at your gut, we need to look at your cortisol, we need to do a Dutch test. All of that is the one-on-one program. This Total Thyroid and Hormone Fix is a group program where I am teaching you literally how to read your own labs, and you are going to learn and write down exactly what thyroid and hormone replacement you need and in the exact dose. So if you're on it now, you're going to learn what you need to change. Ooh, do I need to drop my T4 and add in T3? Do I need to change the delivery method of my hormones? Or, oh, I'm not on hormones at all. I'm going to learn what my body actually needs. And then you are going to write those down. We approve it. And then you meet for 10 minutes with a prescriber. This is not an in-depth meeting where you're talking about your life and your symptoms with a prescriber. It's just, this is what you need. Okay, we are sending it in. Boom, done. So if you need more in-depth, this is quick and easy. This is affordable. This is for people that cannot afford and that do not want to do an in-depth one-on-one program. That is why I built this. Let's see. Can I take my testosterone injection and hormone fixer? My total testosterone is now at a 151. You can take them both. I often do. I take my hormone fixer as well. Okay. Yeah, I take my hormone fixer as well. But with a total testosterone, if you're a female of 151, it's not bad as long as you're not getting side effects, virilization side effects. No. Aaron, no, you are in the one-on-one program. So yeah, you're in the in-depth, we are holding your hand. And I would say if you're a more complex case as well, like I said, if you need additional support, we got to look at your gut, we got to look at your cortisol, we might need to do a Dutch test, you've had a history of cancer, then I would say do the one-on-one program. Do the one-on-one. Kimberly, not able to attend live. Am I correct that all calls are recorded? Yep. And I can be in touch when I'm available. I'm not quite, you can watch those when on your own. Absolutely. And then we are going to have a community, and in the community you can contact. There is no one-on-one meetings in Total Thyroid and Hormone Fix. I just want to be clear about that. Let's see. I'm moving to another state. It might be longer than 1 week delay for me. That's fine, Renee. Like I said, all the calls are recorded. Do you test other labs for besides thyroid and hormones? We also add a CBC and a CMP onto those. And let's see. We write the scripts for peptides. Yes, we won't we don't go deep into all the peptides, but if you need a microdose GLP, we can do that. Let's see. Here we go. No, it sounds different. Back then I didn't get it. Yep. This is the same as last. Yeah. And this is the same as last time. We just added in, this is the same as Total Thyroid Fix last year. We added in the prescribing option. And I think you got an email about that too, since you were in the program last year. Lisa, we have 2 different programs in the clinic, 2 different one-on-one programs in the clinic. We have a 4-month and a 6-month. So both of those programs we go over what's in them and everything that's in them on a call. So we posted a link. I'll have my team post the link again. If you do want to book a call and go over what is in the one-on-one programs, you can absolutely do that. Absolutely. If you can't be on live, Terrell, you would just have the community to ask questions. We don't do any one-on-one in Total Thyroid and Hormone Fix. Okay, let's see. Okay. Leslie, you even did it before we had the prescribing option. Leslie says, I did this program. The first time it was offered, it was very informative, made huge progress. I stayed with the maintenance program as my prescriber was not on board. So worth the money. Yeah. So we moved people, everyone that did Total Thyroid Fix last year, we gave them the option to come into the maintenance program and added in the prescription. So yay, that's amazing. Okay. I did the one last year. Yep. Okay. You guys have, and if you were in Total Thyroid Fix last year and you didn't receive the email, it probably went to spam. So go ahead and reach out to info@dramie.com. Let them know that you were in Total Thyroid Fix last year, and we will give you the option to move on over. Let's see. I already signed up for the, okay, Mary C. Amazing. Welcome, welcome. Joan, how long does it take to receive your program info after purchase? It's automated, so it'll go right out. You can start watching the recorded content and you can jump into the community, but our group meetings will not start until June 4th. Won't start until June 4th. All right, everyone. I'm not going to be able to get to all of your questions because we have some prizes to give away. We have prizes to give away. So thank you so much for, Teresa, yay. Welcome, welcome. During a group meeting, can you ask questions? Yes, you absolutely can ask questions during the group. Beautiful, beautiful, beautiful. And Rhonda, if you signed up for a one-on-one call, yes, you will receive an email confirming your appointment for the clinic. Absolutely. All right, everyone. Well, we have had so much fun today. I'm going to stop sharing and come back on to you guys on YouTube. We have had so much fun today. Now is the time to do all of the crazy, amazing prizes. So, all right, we got our list. Okay. Here we go. Giveaways. Okay. So which one should we start with?
Start from the bottom. Give away the big one yet.
Oh, yeah. And then everybody we lost some people. They're going to lose out on the extra bonus. Oh, they dropped off. Shame on you. Shame on you. All right, guys, hang in there because remember, we said everybody that's still hanging out with me, you're going to get something extra. So I'm going to give that to you right now. So remember how I said, I don't know if we should let YouTube hear this or not. No, YouTube, you don't get to hear this because you weren't in the Zoom room. Yeah, I'm going to say goodbye to you because this is prizes for everybody on here. But I hope to see you in Total Thyroid Fix. And I love you. And thank you so much for joining me on here. Make sure you join the Facebook group, Just Fix Your Thyroid. Make sure you buy a copy of the Thyroid Fix. And hopefully I will see you in Total Thyroid and Hormone Fix in the program that we just talked about. You guys got the link as well. It's fixyourthyroid.com/join. Fixyourthyroid.com/join. I'm going to see you in there. You guys stay here.